on silent mode. Restrooms are located next to the entrance of this auditorium, and in case of any emergency, please take note of the nearest exits. We also provide you interpreting devices in 2 languages, from English to Bahasa Indonesia and vice versa. And please be informed that this meeting observes the non-smoking policy. And lastly, for any assistance with Wi-Fi connection, please ask the committee, and they will also be available to assist you in any other matters. Thank you. Ladies and gentlemen, please welcome the Minister of Health, the Republic of Indonesia, His Excellency Bapak Budi Gunadi Sadikin. Ladies and gentlemen, let us welcome JC Dance Company with Asmaradana, contemporary dance depicting love and diversity between humans, nations, and nature. Right, ladies and gentlemen, please another round of applause for JC Dance Company. Right, His Excellency Bapak Budi Gunadi Sadikin, Minister of Health, Republic of Indonesia. Honorable Bapak Pungkas Bajuri Ali, Expert Staff to the Minister of National Planning and Development, Bappenas, for Social Welfare and Poverty Reduction. Honorable Bapak Inyoman Gede Anom, the Head of Health District, Bali Province. Honorable representatives from related ministries and institutions. Honorable representatives from Foreign Embassy in Indonesia, and also to all development and implementing partners present today. We would like to extend our highest appreciation for your endless support and collaboration for the past years. Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon, ladies and gentlemen, distinguished guests and esteemed participants. The Ministry of Health, the Republic of Indonesia, warmly welcomes you to the Indonesia Health Partners Meeting in the island god of Bali. And we will explore the recent health transformation efforts and match them with support from development partners. And my name is Wahyu Iwoho, ladies and gentlemen, and it is my pleasure to be your MC for today's event. As we witnessed Asmaradana dance earlier, we reminded once again how to grow and live in sustainable harmony. And just like the philosophy behind the dance, Asmaradana, today's meeting aims to foster the sustainability and scalability of Indonesia's health transformation efforts, underscoring the significance of managing international cooperation and learning the best practices from one to another. In the next hours, we will have 4 panel sessions to discuss challenges and the best practices for supporting Indonesia's health transformation efforts, as well as testimonials from the beneficiaries and video documentation covering support from development partners. Right, ladies and gentlemen, before we delve into our discussion this afternoon, let us celebrate the success and best practices of Indonesia's health transformation through a snapshot video titled Celebrating the Best Practices of Indonesia's Health Transformation Collaboration in this video. Let's have a look.
The Ministry of Health is committed to implementing health system transformation. The 6 pillars of Indonesia health transformation: primary care transformation, secondary care transformation, health system resilience transformation, health financing transformation, health talent transformation, and health technology transformation. The collaboration in primary care transformation. In its implementation, the focus is primarily on population education, strengthening the role of cadres, launching campaigns and building movements through digital platforms and community leaders. Primary prevention. Addition of routine immunization to 14 antigens and expansion of coverage throughout Indonesia. Secondary prevention. Screening for the 14 leading causes of death for each age group. Screening for stunting and increasing ANC for mother and infant health. Improving capacity and capability of primary care, network revitalization and service standardization for Puskesmas, Posyandu, Labkesmas, and home visit. The collaboration in secondary care transformation. Improving access to and the quality of secondary and tertiary services involves the development of a priority disease service network and the improvement of government hospital management. The collaboration in health system resilience transformation. Enhancing the resilience of pharmaceutical and medical devices. Sectors such as domestic production of 14 routine immunization vaccine antigens, the top 10 medicinal raw materials, and the top 10 medical equipment items by volume and by value. Strengthening emergency response resilience involves initiatives. The collaboration in health financing transformation. guided by principles of ensuring availability, sufficiency, and sustainability, promoting fair allocation, and fostering effective and efficient utilization. The collaboration in health talent transformation. Additional student quotas, both for domestic and foreign students, increased availability of scholarships, and improved facilitation of the equalization process for health workers graduating from foreign institutions. The collaboration in health technology transformation, development and utilization of technology, digitalization, and biotechnology in the health sector through information technology and biotechnology. We hope to benefit from your constructive engagement and collaboration to achieve our common goals. Let's scale up our collaboration.
Right, ladies and gentlemen, please another round of applause for the video. Yeah, they portrayed a visual journey into the impactful initiatives shaping the health landscape in Indonesia through collaboration. And again, we highly appreciate everyone who is involved in making the impossible possible and able to strengthen the tangled threads ahead. Right, moving on to the next important session and to set to the tone, for the tone of our discussion. Now, I would like to invite the Honorable Minister of Health, the Republic of Indonesia, to share his opening remarks on fostering partnership and collaboration in achieving Indonesia's health transformation. Ladies and gentlemen, please welcome His Excellency Bapak Budi Gunadi Sadikin.
Good afternoon, ladies and gentlemen. My apology, because Bali is quite full now, closer to the holiday festive. Now even my plane need to wait until 30 minutes before we get this slot to take off. I believe it happens also to you. So it is to show that how successful the Ministry of Health in controlling the pandemic. So people now are moving around. Ladies and gentlemen, the first thing that I would like to say here is thank you. Because all of you have helped us a lot, not only during the pandemic, before the pandemic, and hopefully after the pandemic. You can see that Indonesia received more than 11 trillion rupiah. If you can go to the next slide, please. 11 trillion rupiah, or around 700 million US dollar, 700 million US dollar, between 2021 until 2025. And this is the first time I review personally what the figures are, because I want to say thank you to all of you that have been contributing to Indonesia. And then on the next slide, we see also the consistency. So it's not only this year or last year, but some of you has consistently supporting us in terms of giving contributions and grant, especially to the health sector. What I can say to you all is some of the figures, including not only your contributions to Ministry of Health, but also the implementing partners, private sector, non-government organizations. But some of the numbers are not including those numbers. So if you can move previous page back, please. At least, pegang screen siapa ya Pak Bona? Coba. Mundur satu. If you see this screen, maybe the numbers is not aligned with the numbers, but this is the numbers that we recorded. And these numbers, some of them, as I mentioned before, including also the implementing partners, but some of them are not including the implementing partner. For me personally, the objective is to get the outcome right, whether it is done by the Ministry of Health, done by the regional government, or done by implementing partner, I don't really care. So as long as we achieve the outcome. So I just want to make sure that everything that you are contributing is well recorded. So you can share this feedback also to your primary entities in the head office. So if the numbers are not correct, feel free to come to us, and then we can reconcile the numbers. And I believe this is the minimum numbers. Actually, it's more than this. I just want to give you some comparison also. The budget for Ministry of Internal Affairs, Pak Tito, is only 3 to 4 trillion a year. The budget of the Ministry of Foreign Affairs of Republic Indonesia is around 8 trillion every year. So I can probably say to them, hey, my grant is actually bigger than your annual budget to those of the ministry. But don't tell them they're very upset with it, especially the Ministry of Foreign Affairs, because you are related with them. But just to give you the feeling of how big the number is. Yeah? Next slide. Now, my second agenda, after saying thank you to all of you, is I just want to make sure that the money that you spend are well spent. Yeah? And it's amazing to see this. What I see in the screen is not tally with this. What I see in the screen is there. It is what we call the screen management of my team. Yeah? Then I need to move here because whatever I see in the screen is not tally with this one. Next slide. I just want to make sure the second message that the money that you spend is well spent, is aligned with our objective. Again, I will stress it doesn't mean that it has to go to Ministry of Health, but at least is aligned with our transformation plan. I know that now the screen is gone. Gitu Pak Bona. Pak Bona, can you help the team at the back? Gitu kan? Okay. So I've shared with you, and you know exactly the 6 pillars that we would like to do. But for each pillar, we have several programs. Next slide, please. I give you an example on the primary care transformation pillar. Yeah? We try to align the funding that we receive from you to each of the pillar, and we can see where the allocations are divided. Yeah? And I'm very happy because most of the money come to the primary care transformations, except for this year, because we are revamping the hospitals. But on the other hand, I'm quite sad also when I realize that on the human resources is quite low. So I think that, and before the health technology is 0, but now because of our several programs in technology, it increased, but human resources, we still use, although we spend quite a lot on that area, using LPDP from Ibu Sri Mulyani, but at least this is something that I would like also to increase the allocations of the budget on the pillar number 5, which is the health human resources. Yeah. And there are several programs inside each of the pillars. And I will make sure that my team, Pak Bona, will make it transparent to you. Yeah? Every year. How we spend, what is our objective, whether we reach our objective or not. Next slide. I'll give you one example. This is on primary care pillar. So we have several key programs there, like example, tuberculosis. So we see that tuberculosis consume one of the most money. And I will show to you later on the complexity of managing a program with multiple donors. Okay? That is something that I need to share with you. I'm coming from finance industry. If you have crisis, you only see 2 institutions, the IMF or the World Bank. Simple. In global finance, there are only 2 big institutions. In global health, there are 20 institutions. So as a Minister of Health, I have to knock the door of 20 people, get to know each of them, and try to understand what are their focus. Because WHO is a policy organization. WHO doesn't have money. And you know, as a banker, I know everything runs with money. Like the car runs on fuel. You cannot run car with rice. You know, you have to use fuel. That is also healthcare program run with money. And because WHO doesn't have money, and there are 20 global institutions that have money, then you suddenly have to see 20 people and try to understand the priorities and get to know each other well. So these are the programs. So HIV/AIDS are high, tuberculosis is high, and the rest. Now we try to map. Actually, I have also my own budget with this program. So on the next meeting, we will share it with you. What are our own budget and what are your contributions to the overall budget? Next slide. This is the intricacies. Like example on tuberculosis program. We have global fund directed to MOH. We also have global fund to our implementing partners. We have USAID. Thanks to USAID, I just received 70 million, you know, for tuberculosis. WHO gave us support also, and recently the government of UAE gave us 10 million US, and we are using it to buy the mobile X-ray produced by our company from Japan, yeah, our partner from Japan. So the issue that I have with me is, because the source of fund is several, the spending of the fund, the uses of fund is also several. And how we control the productivity and efficiency with the source of fund and the uses of fund is a challenge. So that's why now, if I'm not mistaken, we are asking World Bank, with Bill and Melinda Gates Foundation, try to help me to understand where the money is coming from and the money is being spent. Because for us, like example, tuberculosis, our notification number, our estimate is now 1 million. In the last 10 years, we have received more than 1 billion US for many development partners. But still, the number of notifications out of the 1 billion estimation, the highest is only 575,000. So when I came and I see the numbers, I mean, this is ridiculous. We have spent 1 billion of donors' money for the last 10 years, and I don't see any major significant increase in terms of surveillance. Out of 1 million is only 575. So the rest, they're still everywhere, you know, spreading all the tuberculosis. Where? Because we cannot identify this 1 million people after 10 years, after 1 billion US dollar of money spent. And I always receive an argument, it's very difficult to get the tuberculosis patient difficult. It's ridiculous. You know, to identify 1.5 million COVID in 1 year, we able to do it. And COVID-19 testing are more difficult than tuberculosis because it needs the BSL-2 labs, the PCR machines, technician able to do PCR, but tuberculosis is easier. You have the machines that you can put in 10,000 Christmas. So it doesn't make any sense if 10 years we only can get 575,000, where in COVID, in 1 year, we can get 1.4 million with a much more complicated, you know, testing. So there's something wrong with us. So that's why, from my perspective, the productivity, the efficiency, and the effectiveness of our money need to be improved. So this is just one of the examples. And having a multiple source of fund and uses of fund puts some complexity in it. So that's why what I'm asking to you is, I would like, starting next year, when we start a project or program, we do an implementation research with it. So I'd like to ask some of your money to be allocated to do implementation research. In my term, it's like a policy research. So when we do this, you know, we change the tuberculosis resistance regime from normal one, 20 months, you know, 20 months delivery of the drugs, change to BPAL and BPAL-M, which is the regime is only 6 months, then I want to see how effective it is. So when we start the implementation program, then we start also the implementation research. That involves the donors, multiple donors, and also involve the university and local universities of Indonesia, wherever they are. So then we can get the report every year whether the policy or the program that we are implementing is very efficient or not. So that is the second topic that I would like to share with you. Starting next year, we will always do a policy research program or implementation research program systematically for every programs that we run with donors. And I would like to ask from you to get the tiny part of it, because it usually is not involving a lot of money. Maybe get one of the experts coming from outside, working with the local university, to check the effectiveness and efficiency of our policies, of our programs. And that will involve multiple sources of fund and multiple uses of fund also. It will involve not only a single donor perspective, but multiple donors perspective, and also several implementer. One government agency, maybe 4 or 5 non-government agencies. Because I want also to measure whether use of these non-government agencies are effective and efficient or not, and what can we improve with them, because they also receive donors' money. Yeah, and I'm okay with that as long as it is aligned with our programs. Yeah. My target for all of you, like example in tuberculosis, I want to have, I do hope when I retire I can get it next year, 90% notification rate. So estimation numbers, 1 million tuberculosis. I want to have next year 900,000 of them identified by name, by address. And out of this 900,000, I want to have 100% enrollment or start the medications, that is the term, enrollment, 100% enrollment for the normal TB, and 90% enrollment or start medications for resistant TB. So 1 million estimation, the first target in 90% notifications or identification. Out of 90% notification or 900,000, I want to have 100% enrollment for normal TB and 90% enrollment for resistant TB. Out of these two, I want to have, this one I forget the numbers, 100% or 90%? 90% if I'm not mistaken. 90% success rate. So out of these people that enroll to start medication of TB, I want to have at least 90% success rate. So they can continue consume the medication for 6 months continuously without any failure, or for 8 months or 20 months, for resistant TB. So those are the numbers. Whether it is being done by the government agency, another private sector agency, or non-government body, I don't really care. But the target should be the same. So I would like to ask the donors also to measure that target across the implementing agency. I think that will increase the effectiveness and efficiency of the money that we spend. So that is topic number 2. Next slide. Now topic number 3. We increase our budget, and we will suddenly give me increase our budget. But then I realized that it's still not enough if we would like to be aggressively, making our population healthier. And unfortunately, some of the programs are just being finalized outside of the budget cycle. So I give you an example like this. Because it started in June or July when I was contacted by my colleague from the United States that we will have an APEC meeting. And U.S. Secretary of Health and Human Services, we want to push the project called Project Moonshot. Project Moonshot. What is this? It is cancer eliminations. And one of the key is cervical cancer elimination. So if you want to support us, then we will give you some technical assistance. So I always very happy if somebody want to help me, right? So why don't you give me a technical assistance and develop the national cervical cancer strategy? Because we don't have any. And then I said, who are the most aggressive country? And they said, Canada is the most aggressive, Australia is quite aggressive, and Malaysia. Why don't we try to beat them all? So that is a very ambitious target, right? In a good sense, So why don't we try to beat them all and make the most ambitious target? So this team make an ambitious target, work with the US government, and then we develop the plan. And we share the plan using, during the health ministers meeting, APEC health ministers meeting in Seattle, I share it with them. And then we launch it properly before the leaders meeting. Yeah, after my president have a bilateral meeting with Joe Biden. So we launch it. And we launch it is on September. So the budget cycle is already off. And two of the major initiatives that involve money, number one is we would like to increase the aggressiveness of the immunizations. We just started a national HPV immunization this year, age 11 and 12. We want to ramping it up with age 15, who missed this 11 and 12, and also then increase to age 21, women, aggressively. And after that, we want to start vaccinating the boys. Not many countries are doing it, but what I heard from, if Australia is doing it, Canada is doing it, Malaysia is doing it, and they said they are the most aggressive country, then I want to be more aggressive than they are. We are also vaccinating the boys, 11 to 12. So when increase the vaccination coverage, then we have a lot of more budget to fulfill. So we reallocate some of the budget, but there are still gaps. I'm lucky that I'm just being appointed as the Gavi board member, so maybe I can use my influence, to get some free vaccine from Gavi. Indonesia now is being aggressive to putting Ibu Endang is sitting at the board of Fine. Ibu Rizka is sitting at the board of SEPI. Dr. Dante is sitting at the board of Global Fund. So we try to be as aggressive as we are, getting our seat in the board so our voice can be heard. So at least our voice can be heard. Yeah. So hopefully I can get it from Gavi, but if you want to contribute also some vaccine, I don't need the money, I need the vaccine, I will be very, very happy. MSD is a US company. If USAID want to help MSD, to procure a vaccine for us, I will be very, very happy. Yeah? Especially when my colleague Bechara is not as aggressive as me, then you can send a vaccine to Indonesia and we can vaccinate all of those people, all of those ladies in Indonesia. And the other part also I saw a lot of gap in terms of surveillance, because we want to change the surveillance strategy from using pap smear and IVA tests to HPV DNA tests. So this HPV DNA test should be done for women in the age of 30 to 69, at least twice in their life. And the population is 40 million. I just realized, Indonesia have so many women at this age. So I need to do at least 42 million times 2 in the next 10 years. So if we can do 42 million in the next 5 years, screening, it will be wonderful. Because if we can do early detections of the cervical cancer and chance to be cured, it's much, much higher. It's much, much higher. But then this is again something that we haven't put into our budget because it's off the budget cycle. So we are reallocating also some of the budget. But if some of you would like to contribute, that will be wonderful. And I don't need the money. I need, the screening. So if you want to do the screening by yourself, it's also good. If you are, you have, implementing agency that can do the screening for Indonesian women for me, I will be more than happy. As long as when they screen, they input the data in our Satu Sehat application so we can monitor and track the effectiveness of the screening. So these are the examples of what the gaps that we identify in our programs. And again, this one doesn't have to be money. As long as the outcome is reached, I'm very happy. It also doesn't have to be through us. If you can go to the private sector, as long as the outcome is being reached, I don't have any issues. I don't have any issue. My only issue is you have to register that in my Satu Sehat platform so I can monitor and track whether the outcome has been actually achieved or not. Next slide. And by the way, the newborn screening, Indonesia is the only country when I joined that never done any newborn screening before. And then I check around. How about Singapore, Malaysia? Don't talk about Malaysia and Singapore. They are far ahead of us. I talk to Vietnam. They are far ahead of us. Talk to, I think my country is equal to Bangladesh, Tonga, Yemen, those countries. Because we never done newborn screening testing. So we just started newborn screening this year to 4.8 million babies. And we started very, very slow, but now we can do 60,000 a week. So if multiply by 52 weeks, it's around 3.5, 3.6 million babies, because we have 4.8 million babies every year. So that's why when we already successful with the first newborn screening, the congenital hypothyroid, next year I want to increase into 3. So we add additional congenital adrenal hyperplasia and also the G6PD. So 3 newborn screening will be launched next year. Yeah. Okay, that is examples. Next slide. Now, this is my last chart. So first, again, I would like to thank all the donors for 700 million-ish grant that I have received, and it is a very big amount of money. Second, with this amount of money, I just want to make sure that I get back to you with the right result. I don't want to spend your money and after 10 years, there is no movement in the outcome. So I want to have a movement. Because of that, I need your help also to work together with me, several donors together in one program to do an implementation research for every program that we have. So then we have a very clear measurement annually and what are working, what are not working. So then we can change our policy every year based on this result. And we can have a time every year to discuss this together, whether the money that you spend is on the right policies or not. Yeah? And number three, we have still several gaps. I know each of the donors have their own preference. Somebody are more closer to mother and child. The other donors are more closer to cancer. The other donors are more closer to infectious diseases. It's up to you. You can pick and choose. But these are the priorities that we have a whole in our budget. And again, you don't have to send the money to me. As long as I get my outcome, I'm very more than happy. You can go to me, you can go directly to the regional government, you can go directly to the private sector, you can go to other implementing agency, but you have to make sure it is recorded in our system. So I can measure the system and it is for our benefit. And the last one, this is a good habit. At least I communicate back to all of you. Yeah? Actually, I would like to make a book and distribute to all of you now. But you know, to move the Indonesian bureaucracy also takes some time and tenacity. So hopefully I talked to Pak Bona. At least we have to have 2 meetings every year. One is before our budget sessions. So we share, hey, this is our annual working plan based on this 6-pillar strategy. Share it with the donors so the donors know, well, these are the plans. So where your money is spent, we can open. This is the indication that how much money the Indonesian government will spend into this area. And we can identify the gaps. So the donors then can choose the gaps. So they are not shooting from the hips when they want to establish a programs. They know exactly what are the programs that is needed by the Indonesian government. They can choose the one that's suitable to their priorities. That is on the first meeting. On the second meeting, we do it maybe February or March to review. What have we done? And I want to see also the implementation research for key program is already being finalized. So let the team from University of Indonesia, like as example, share the successful of the programs of implementing 10,000 ultrasound in Puskesmas. Whether it's being used, whether the mother feel the benefit, and whether there is other opportunities. It's not only used for mother and child, but the ultrasound can be used for cancer detections maybe, or maybe used for hepatocarcinoma early detections, or whatever it is. Because by having an ultrasound, you can do a lot of things. So that is the reason why I'm coming here. And again, thank you for your participation. And we have to meet at least, twice a year. So, thank you.
Thank you, His Excellency Pak Menteri Budi Gunadi Sadikin, for your endless support in transforming the national healthcare system in Indonesia throughout the years, and also throughout the pandemic, Pak Budi, for your effort in changing and transforming the healthcare system together with you, all partners and donors. Right, ladies and gentlemen, since we have the Minister of Health of Indonesia this afternoon, let's take the opportunity to take a photo together. Just please stay on your seat. I will ask some of photographers and also videographers to join me on the stage. You can have a seat. We have a photo session before we commence the next agenda. Just get ready. All right? Ready? Get your smile ready. Ladies and gentlemen, on my count. In 3, 2, oh, wow, okay. Brighter, right? Okay, in 3, 2, 1. One more time. Right, once again, on my count in 3, 2, 1. Thank you very much. Right, okay, thank you, photographers. You may return to your spots. And also, thank you for your cooperation, ladies and gentlemen. And next, to bring a personal touch to our discussion, let's hear directly from two beneficiaries of the Primary Care Transformation Overseas Grants Program, who we invited specially for this event. First, we have Ibu Nur Hidayati, a teacher and also health cadre of Aksi Bergizi by UNICEF in Nusa Tenggara Barat, another heavenly island in Indonesia, just close next to Bali, just a few minutes flight from Bali Island. And following that, we have Ibu Helena Pakiring, a doctor and beneficiary of tuberculosis elimination training from the Global Fund, all the way coming from Abepura, Papua Regional Hospital. Ladies and gentlemen, please welcome on stage Ibu Nur Hidayati and Ibu Helena Pakiring to share their testimonials. The stage is yours, ladies.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh.
Salam sejahtera dan selamat siang buat kita semuanya.
Om Swastiastu, Namo Buddhaya, salam kebajikan. Perkenalkan, nama saya Ibu Nur Hidayati, biasa dipanggil Ibu Yati. Saya adalah guru di SMP Negeri 1 Labu Api, Kabupaten Lombok Barat, Provinsi Nusa Tenggara Barat. Saya adalah fasilitator terlatih Aksi Bergizi, sekaligus kader UNICEF untuk program Aksi Bergizi. Aksi Bergizi dilaksanakan di sekolah kami, thank you so much. Dilaksanakan di sekolah kami sejak Januari tahun 2019 dengan durasi waktu 2 kali 35 menit setiap hari Rabu, dimulai dengan kegiatan yang seru banget, ada sarapan bersama, minum tablet tambah darah, dan sesi literasi untuk siswa kelas 8. Tujuan program ini adalah untuk memastikan remaja usia sekolah bisa hidup sehat, terutama para ibu, diharapkan nantinya, terutama remaja putri, yang nantinya diharapkan bisa menjadi ibu yang terdidik dan sehat. Saya sangat tertarik dan sangat bersemangat, sangat bersyukur sekali bisa menjadi kader dari program Aksi Bergizi ini karena saya mengetahui betul manfaat dari program Aksi Bergizi ini tidak hanya bagi murid-murid saya di sekolah, tapi juga bagi diri saya as a mom dan juga keluarga lingkungan di sekitar saya. Aksi Bergizi ini ibarat cinta yang dibutuhkan oleh kita semua, Pak Menteri. Dan ya, adapun manfaat dari Aksi Bergizi ini bisa dilihat dari tiga kegiatannya. Yang pertama, sarapan bersama, itu meningkatkan keakraban, kekeluargaan, tolong-menolong, kekompakan juga. Dan tablet tambah darah yang diminum setiap hari Rabu itu mencegah murid saya dari anemia dan stunting juga. Nah, untuk sesi literasinya ini benar-benar luar biasa. Di sana anak-anak dibuat gitu ya, atau dikuatkan dalam hal berpikir bernalar kritisnya, kemudian mandiri tapi juga kolaboratif dan reflektif. Seperti itu, student agency juga dikuatkan dalam program Aksi Bergizi ini. Adapun tantangan yang kami hadapi di awal-awal itu, terutama bagi siswa baru ya kelas 7 di sekolah kami itu mereka ada rasa enggan, beberapa aja sih ada rasa enggan untuk minum tablet tambah darah, karena mereka belum tahu apa itu TTD dan manfaatnya. Tapi itu bisa kami atasi dengan kerjasama komunikasi dengan orang tua, kemudian dukungan juga dari Puskesmas Labu Api dan peran aktif Besti Aksi Bergizi. Saya sangat berharap program ini bisa dilaksanakan di seluruh sekolah di Indonesia, tidak hanya di tingkatan SMP, SMA sederajat, tapi juga di sekolah dasar. Terima kasih yang sedalam-dalamnya saya ucapkan untuk UNICEF, Kementerian Kesehatan Republik Indonesia, pihak-pihak yang memprakarsai program aksi bergizi ini dan juga menyusun modul ajar aksi bergizi yang luar biasa menyenangkan banget untuk di-delivery ke siswa. Dan pastinya pemerintah Lombok Barat, Dikes Lombok Barat, Dinas Kesehatan Provinsi Nusa Tenggara Barat, terima kasih untuk kepala sekolah saya juga yang memasukkan aksi bergizi ke dalam kurikulum sekolah kami. Dan Dikbud Lombok Barat juga. Dan tentunya untuk Pemda Lombok Barat serta orang tua murid SMP Negeri 1 Labu Api yang luar biasa mensupport program ini. Demikian dari saya, terima kasih. Kita akan lanjutkan testimoni dari Bu Dr. Helen.
Terima kasih. Saya Dr. Helena Pakiding, saya dokter spesialis paru. Saya sudah berpartisipasi di program eliminasi tuberkulosis di Provinsi Papua 3 tahun terakhir. Jadi program ini dijalankan di 29 kabupaten kota dengan melalui hibah dari Dana Global Fund. Tujuan program eliminasi tuberkulosis ini yang pertama adalah kita mempercepat eliminasi TB tahun 2030 dan mewujudkan Indonesia bebas tuberkulosis di 2050. Dan kita juga meningkatkan program kegiatan kolaborasi TB HIV juga. Manfaatnya banyak yang kami dapatkan, baik itu kami sebagai nakes ataupun dari layanan kesehatan maupun dari pasien-pasien sendiri. Kalau dari nakes mungkin kami bisa meningkatkan kualitas keilmuan kami, meningkatkan kualitas pelayanan kami melalui pelatihan tuberkulosis ataupun rapat evaluasi klinis. Kami melihat bahwa di layanan-layanan yang melakukan pelayanan tuberkulosis, OAT, logistik non-OAT juga tersedia. Terutama untuk pasien-pasien, mereka bisa mengakses pelayanan dan pengobatan maupun untuk diagnosis itu dengan gratis. Untuk pasien-pasien tuberkulosis resisten obat, yang terutama mereka setiap bulan bisa mendapatkan enabler. Dan untuk pasien-pasien yang baru terdiagnosis tuberkulosis resisten obat, mereka diberikan juga enabler. Ini memacu supaya mereka mau untuk memulai pengobatan, karena itu menjadi tantangan di Papua. Kemudian apakah tantangan-tantangan lain ada? Ada. Jadi pemahaman tuberkulosis untuk pasien dan keluarganya itu memang harus terus diberikan. Karena kalau mereka tidak punya pemahaman yang benar, maka mereka terkadang banyak untuk menolak memulai pengobatan. Apalagi di Papua, media komunikasi yang berbahasa lokal itu memang masih sangat kurang. Kemudian apalagi dukungan dari Pemda yang harus dioptimalkan. Kita tahu bahwa Papua punya letak geografis agak berbeda, gunung-gunung, maka ini menjadi tantangan buat kita mempunyai strategi yang khusus bagaimana pelayanan TB ini bisa sampai ke yang kampung-kampung. Ini adalah tantangan yang ada saat ini. Kami berharap bahwa program ini tidak berhenti tetapi dilanjutkan. Saya mendapat titipan Pak Menteri dari teman-teman ada di grup bahwa kalau pasien TB-RO itu mendapat enabler, tolong berikan reward buat petugasnya. Itu agak ramai. Yang kedua, kami juga berharap bahwa pasien-pasien tuberkulosis tidak semuanya mampu. Kebanyakan mereka ada yang tidak mampu. Maka mungkin kami usulkan ada pemberian makanan tambahan buat mereka. Dari semuanya itu kami berterima kasih buat semua donor, buat pemerintah maupun setiap stakeholder yang sudah mendukung supaya layanan tuberkulosis, TB HIV ini bisa sampai di layanan, sampai di Papua dan mungkin seluruh Indonesia. Kami berharap bahwa Global Fund tidak berhenti sampai di sini, bisa terus membantu untuk eliminasi tuberkulosis di Indonesia. Terima kasih.
Wassalamualaikum warahmatullahi wabarakatuh. Selamat siang.
Terima kasih.
Right, once again, Please give another round of applause for our perfect combo, the dynamic duo from the ladies, which shows you the efforts amongst the health warriors in Indonesia. And for your information, I would like to inform you that Ibu Helena, coming from Abepura in Papua, it took about almost 2 days, right, Ibu Helena, from Abepura, Papua to Bali, as she needed to took multiple flights from Abepura, Papua to Sentani, Jayapura, and then next to Jakarta, and last to Denpasar, Bali, only to share to us about her efforts. Once again, for Ibu Nur Hidayati and Ibu Helena. Right, next we are privileged to hear from key figures who play a crucial role in Indonesia's strategic development plan. And first, a remark from the Minister of National Planning and Development, or Bappenas, that will be represented by Bapak Pungkas Bajuri Ali, expert staff to the Minister of National Planning and Development, or Bappenas. And ladies and gentlemen, without further ado, please welcome Bapak Pungkas Bajuri Ali.
Baik, terima kasih. Mohon maaf saya harus membaca karena saya membacakan pesan Pak Menteri. Jadi saya harus membaca ini. Good afternoon, Honorable Minister for Health, Bapak Budi Gunadisadikin, Bapak Ibu Dirjen, Pejabat Eselon 1, Eselon 2, Kementerian Kesehatan, Kementerian dan Lembaga, Kepala Dinas Kesehatan Provinsi Bali, representative from embassies, development partners, implementing partners, all invitees and participants. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to convey a warm regard from Pak Suharso Monoarfa, our ministers who unfortunately couldn't attend this meeting, a very important meeting. And we really appreciate the Ministry of Health for this initiative. To conduct Indonesia Health partner meetings in these very beautiful islands. I think it's about time for us to work together for better health for all. Ladies and gentlemen, in a very short time, we will welcome a new year. It seems times fly very fast. Not a long time ago, we set out the target for 2024. We set the strategies, we set the agendas of National Medium-Term Plan 2020-2024. And here we are close to the end of that period. We record a number of achievements in health outputs and outcomes. At the national level, economic growth has bounced back to the positive and stable growth. And with the leadership from the Ministry of Health, we are successfully navigating through the journey through the COVID-19 pandemic. In these very occasions, I would like also to pay our respect and appreciations for the Minister of Health, Pak Budi Gunadisadikin, for embarking national health system reform. Achievement in health are marked obviously by curbing the pandemic itself, but we also see notable progress in maternal and child health, accessibility and the quality of health care, both primary, secondary care, and steady progress on universal health coverage. However, challenges remain. While death caused by non-communicable diseases increased, we are still witnessing the persistence of infectious diseases, neglected tropical diseases, and malnutrition. 2024 plays crucial roles in the future health strategies, such as the implementations of Health for All 2045 long-term agenda, or Indonesia Emas 2045, accelerations toward fulfilling the Sustainable Development Goals 2030, and the formulations of medium-term plan, both at the central and subnational level, as well as 5-year MOH strategic plan. In our perspective, 2024 situation is as follows. First, there are numbers of targets need to be achieved and problem to be solved. So we need to prioritize what are left behind in achieving remaining 2024 targets. Second, we need to accelerate our efforts in the commitment of the governments, among others, reducing maternal mortality, reducing under 5 malnutritions, and achieving universal health coverage. And the third, accelerations of equity among regions, especially in the eastern part of Indonesia. Despite all the progress, health development is also still struggling on many fronts. Unlike many other developed countries, access to primary health care remains problematic, such as stunting, low coverage of immunizations, neglect tropical disease, access to safe water and sanitation. NCD, non-communicable diseases, as the main cause of death and disability is constantly increasing. And new megatrends that will affect our health of populations emerge, such as aging populations, mental health, and climate change. So in 2024, we have jobs to deliver the President's visions and accelerations effort to achieve RPJMN target, as I mentioned earlier. And most notable targets 2024 to work hard, including reducing stunting, tuberculosis incidence, eliminations of leprosy, increased immunization coverage, curbing obesity and smoking. And in terms of healthcare, our main challenges is on the referral health hospitals and primary care accreditations and deployment of health workers at the puskesmas and hospital as well as push to level. Ladies and gentlemen, Indonesia is among the lowest per capita health expenditure, both in terms of total health expenditure and public health expenditures. But I assure you that it has not been the case of low political commitment, but it's limited overall state revenue. Limited financial resources should not limit our strive and thrive ambitious agenda. The meeting today, with the presence of development partners, is a sign of health in all strategy at work. The government fund is not the only source of health development. We have business entities, we have philanthropists, development partners, and we have people, and we have community, and this is what the spirit of health for all means. Therefore, we would like to reinforce what Pak Budi has said earlier in pursuing the aspirations of everyone, every individual in these rooms, the aspirations of all peoples in Indonesia for a long and healthy and productive life. This long-term goal has been casted in our draft of long-term development plan, or Indonesia Emas 2045. We want that all peoples are healthy, all people have adequate access for health care, whoever they are and whatever the care they need. This is also to reiterate the call, health for all, in long-term plan 2045. Again, challenges are enormous, but together with your support, we will navigate all the challenges together. And I would like to thank all the development partners for your continuing support, your financial resources, energies, assistance, and ideas. To conclude, it is an honor for me to have an opportunity to speak in these honorable forums, and I wish everyone enjoys an inspiring and fruitful discussions. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Right. Thank you, Bapak Pungkas Bahjuri Ali, for delivering the remarks from the head of Bappenas, which its role is very crucial in making strategic planning on Indonesia's healthcare system. Right, ladies and gentlemen, now let us move on to our first panel discussion with the theme of Prevention Wins, the breakthrough of Indonesia integrated primary healthcare. And our esteemed moderator will be led by Mas Wahyu Budi Santosa, is currently the technical advisor at Think Well Institute in Jakarta, Indonesia, focusing on the strategic purchasing for the primary healthcare project. And Mas Wahyu has been support the implementation of a consortium to pilot primary care transformation. Right, ladies and gentlemen, without further ado, please come up to the stage, Mas Wahyu Santosa. Good afternoon. Good to see you, Mas Wahyu. Wahyu and Mahyu. And Mas Wahyu will be accompanied by our key representatives from Director General for Public Health, Ministry of Health, Republic of Indonesia, Ibu Maria Endang Sumiwi. Good afternoon, Ibu. Welcome to the stage. Please have a seat. And next we have Director General for Disease Prevention and Control, which will be represented by Bapak Imran Pambudi, Director for Communicable Disease Prevention and Control. And also we have the representatives from ADB, Mr. Jiro Tominaga, Indonesia Country Director. Welcome, sir. Please have a seat. And next, we have the representative of the Government of Australia, Ms. Madeline Moss, Minister Counselor for Governance and Human Development. Good to see you, ma'am. Thank you. Have a seat. And last, we have Mary Jane Lacoste from Momentum as the USAID implementing entity. You, ma'am. Thank you. And I will hand over to Adar Wahyu on the stage. Enjoy your stage, and the stage is yours. Thank you.
Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Thank you very much, Pak Wahyu. And of course, it is an absolute honor to be here with the 5 really all-star panelists in here. Thank you very much for coming. And again, I would like to say welcome to all of you, the audience in this room. Well, as a huge archipelago, our country, Indonesia, relies on each people's awareness and commitment to live healthily. And this first panel will be a thoughtful discussion about the transformation of primary health care. And this panel will be focused on 3 topics. First of all, we want to understand the paradigm shift in primary health care in Indonesia. And then we also want to better understand the community-centered health promotion. And lastly, we want to discuss about the capacity building for integrated primary health care. So this is going to be sort of like, a little appetizer. We're not going to get into everything in a tremendous amount of detail. So if you have any question, please feel free to follow up with our panelists afterwards. So, for the first question, maybe I'm going to start with Ibu Endang. Okay, Ibu Endang. My first question is about the transformation of primary healthcare in Indonesia. How has the primary healthcare paradigm in Indonesia transformed, and what factors have contributed to this transformation?
Thank you. Good afternoon, everyone. I will start first with the drivers of the primary healthcare transformation, because the transformation actually evolved around these drivers. So the first one is the change of paradigm from curative to promotive preventive. And it's just aligned with actually the SDG number 3, which is ensure healthy lives and well-being for all at all ages. So our system has been very heavily drive towards curative before in the primary healthcare. Now we are changing this to the promotive and preventive. The second driver is that our current system has not been able to reach everyone. We can see from the achievement of the minimum service standard that none of the indicators actually achieve 100% in the districts level. So meaning that we need to do something on strengthening and reaching everyone, as we say that the healthy lives is for everyone. And then the third one, the drivers, is that we see in the primary healthcare how we deliver the service was still fragmented. It's very programmatic based, and because of that, then sometimes when certain program is not strong enough, then the services will be lacking in that area. So that is also another driver, and because of those contexts and those situations, our transformation actually evolved around, and we design the transformation. Number one is to ensure that our service is people-centered. So people is in the center of our service, and how we translate this people-centered is through life cycle approach. So all our standard now and our approach is actually based on life cycle. We make standard on within the certain life phase, what package of service that our people need to receive. So this is the first transformation, the first focus is life cycle. So all intervention is integrated, focusing on this life cycle. The second is because we haven't been able to reach everyone, we strengthen the structure of primary healthcare. First step this year is this 2 years is to strengthen the village level services through Pustu and also through Posyandu. The second step will be next year, we will strengthen the school network and the place of work network, but also the private facilities network. And then the last one is the transformation on the digital transformation in primary healthcare, so that it can help local solution being implemented, because we know the local problem. At the moment, we haven't really has a very comprehensive dashboard or very comprehensive data on, for example, what is the situation of health in certain village. So actually, the people in that local entity can address by themselves. So this is the 3 focus in the health transformation, primary health transformation. One is the life cycle approach. Second is strengthening structure so we can reach everyone. And the last one is the digital transformation so we can help local solution because they know the local pattern of health problem. Thank you.
All right, thank you very much, Ibu Endang. And my next question is for Pak Imran Pambudi. So I think another important issue about the primary health care is the alignment between primary health care and also the changing health needs of the community. So my question for you, Pak Imran, what specific strategies have been employed by the Directorate General to align between primary health care and the changing health needs of the population? For example, the evolving landscape of infectious diseases.
Yeah, good afternoon, everybody. Allow me to represent Pak Maksi, the DGN of Communicable Disease Prevention. So regarding for the questions about the lending landscape, yeah. So communicable disease quite have make disability and also mortality during these years. And we also can see from the COVID that we have to change this one. Like Minister Budi mentioned about the transformation. So the communicable disease, along with this transformation also, so we have from 6 pillars, we have 3 pillars that really enclose with our activities. First is about the first pillar about health transformation for primary service transformation, and the second referral service transformation, and also health resiliency system transformation. And for the principles of communicable disease, so we have to make the prevent, detect, and response. So it means that we should build or develop these 3 principles from the community. It means that the community has to have ability to know how they prevent the communicable disease by healthy lifestyles, like Bu Endang mentioned. And also they have to know that they have to prevent for the communicable disease from the with the immunization also. And to detect, so I think it is important also that community should know when and how to report the disease if they got impacted. Because sometimes, especially during what we call the zoonosis things, that maybe Bu Madeline will be also have what we call the story for this one. Sometimes people not really know the problem of zoonosis things. Zoonosis is the disease caused by the animal. So it's important to them to know this is the disease that impact that caused by the animal, and then they will impact to the human. So sometimes they didn't know, and they don't know how to report. This is a very important one. So this is the how to detect. And the other things to detect is how we can optimize the health centers and also laboratory. Minister Budi said that we want to expand the laboratory in the primary care. It's also an important one. So the detection of the communicable disease will have more improved. And the third is the response. It means the community should know how to deal and how to manage the communicable disease. It means that they have to know how they want to treat. They have to go to the hospital, clinics, and also the clinics is also from government and also the private sector. So it means that we have to make all of the clinics, government and private, is a standard things. Because now, for example, if we're talking about the screening for the HIV, screening for the hepatitis B in the pregnant mother, antenatal care is around 53% is in the private sector. So it means that how we can develop public-private is also important to what we call, to enlarge our networking. So all of the population can access with a good quality. So I think that's several things that we already do in the Ministry of Health, and we have to make sure that all of the stakeholders all of the components should be enclosed in the collaboration. Thank you.
Excellent. Thank you very much, Pak Imran. And I'm now moving to Mr. Jiro. Could you please share to us your overall experiences or your overall maybe perspective partnering with the Ministry of Health, the Republic of Indonesia?
Right. Thank you. Thank you very much. I think the partnership was excellent, and I hope that sentiment is being shared by colleagues in the Ministry of Health present here. I think, but in terms of the partnership, I think there are a couple of things that probably I may want to premise a little bit on my response. First is that we really consider the developing health and human capital is a very critical part of Indonesia's development path towards the high-income country in 2045. Because human capital is a rare type of capital that you can actually get an increasing return from investment. On the other side, in the physical capital, you usually use a decreasing return, right? So that's very important. Secondly, I think Indonesia has been making a steady improvement in the key health indicators. However, it is still kind of lagging behind some of the fellow countries in Southeast Asia. So I think there are bases for Indonesia to do better, and then I believe Indonesia can do better, and then also Indonesia must do better. So in that context, I think there are a lot of issues. We talked about the communicable diseases, non-communicable diseases, nutrition-related issues, stunting, obesity also among the children these days. So there are a lot of structural issues that the challenges are being faced by the authorities, the Ministry of Health in a country. I think in that context, I think the shift in terms of the paradigm of the focus that Ibu just mentioned about the changing it to the prevention, primary healthcare level, and then also life cycle-based healthcare services approach. I think it makes a lot of sense, and we're very much excited that we are being able to support our Ministry of Health in that sense. There are different areas that we have been supporting: integration of healthcare delivery systems or the health worker capacity, and then also in terms of the information coordination. But I think the one thing that I just want to mention about the partnership is that we are very much impressed with the leadership and then also the ownership that this government is having about improving the health situation in Indonesia. And then we are very happy to support that effort. There's one example that recently we worked on an investment project together with 4 multilateral development banks, with the World Bank, AIIB, Islamic Development Bank, and ourselves in a record speed, and then also with the very much quality. And then this is, with the very strong leadership and request from the government in terms of delivering the solutions with speed and scale. And we were able to do, I'm very happy that we're able to at least coordinate closely to try to reach our, meet the expectation. At the same time, I think let me also mention that we've learned a lot from that coordination experience in working together as development partners. Thank you.
Yeah, thank you very much, Jiro. And my next question is for Mary Jane and Madeline. So talking about the primary health care, I think we should also consider the community-centered health promotion, which is very relevant to the community-driven health initiatives. And my question for you is, what are the key success factors in community-driven health initiatives, and how can they be replicated or adapted in different regions? Maybe I'm going to start with Mary Jane. You have like 2 minutes to answer because the session is time sensitive. Many apologize, Mary Jane.
Thank you, Wayu. And thank you very much for the invitation to be on this, this panel today. So with the community piece, I think there's just so many opportunities there, and there's so much being done at the national level to create that sense of access, or create access, and to bring services closer to community. But in some ways, it also feels that we need to be almost starting a movement at community level. You know, I think Bu Helena mentioned earlier about the importance of information, education, communication for community members so that they know what they should be expecting, the services that they should expect, and that they can also then put pressure bottom up on the health system to make sure that they get the services that they are entitled to. So I think that's one really important part of it. I think another key factor is the importance of those interministerial partnerships at community level, because it's not just Ministry of Health, obviously, that's implicated in this. You have the Ministry of Villages, Ministry of Home Affairs, and making sure that there are ways to access that funding in order to support a stronger community health system. And then I think I would also just talk about, this relates back to kind of the information, education, and communication, the empowerment of the communities. I know that the ministry has been very actively pursuing social accountability and pushing that down to lower levels at community level. I think that's a really important initiative that lines up very well with ensuring the quality of primary health care services and making sure services are available. And then I think one of your questions was about how do you share that information. So the ministry is establishing, or has established, a primary health care consortium, which I think is very important, bringing together all of the partners and collaborators who are supporting the ministry's vision for this transformation, and linking that primary health care consortium at national level down to POCJAs at provincial level, down to POCJAs at district level and other community structures, so that you have information flowing up and down about best practices and not just waiting for a final project report in order to disseminate something that's been successful.
Thank you very much, Mary Jane. So maybe after this session, I'm really happy to hear your story about your study in 44 district for the LP implementation. So the next, the same question for you, Madeleine.
2 minutes, right? This is very ambitious.
Sorry, because
Look, I'm going to take some of my 2 minutes actually to make a more general comment, if that's okay, which is to say I think this is a really fantastic initiative, and I want to thank the Minister for Health for bringing us all together. You're always very clear in how you communicate with us, and I think actually the only challenge that us development partners sometimes have is keeping up with you and your ministry and your vision, and that's a great challenge to have. I like to have that challenge, so thank you so much to you and your senior staff for being so generous and letting us work with you on the health transformation agenda. I am probably most similar to Pak Bona in that I'm a diplomat and I'm not a health expert. But I think when we're talking about working at the community approach, what I've observed is that if you don't bring the community with you in terms of awareness and education and socialization, it really makes it very difficult to get sustainable, good health outcomes, because the community won't understand what you're trying to do. And I think I've had some recent examples of this, and I've talked about this with Pak Imran, looking at some of the, a range of issues, but I was going to talk about rabies in new parts of Indonesia where there hasn't been rabies before, and making sure that I think communities understand what they can do, first of all, to help themselves and take care of themselves, and when they go to the puskesmas and what they should be asking for and can expect when they go there, and also for the health workers at the puskesmas as well, giving them that information. And that can make a really big difference and save lives in a very practical sense. So we have John Lee here, and I know I also have colleagues here from our Prospera program who work very closely with Ministry of Health. They will be able to give you a more technical example, but I think for me, really involving the community and making sure that the workers at the puskesmas and at the province level and the local level and the community understand, I think that's really, really key. And I think we also saw that all through COVID as well, with people feeling empowered with information to be able to come forward and make decisions about their own health. And just to reiterate, I guess, that I really do believe that the prevention and primary care agenda that is being pursued by the Indonesian government, the Ministry of Health, really represents like the best buys, the most efficient, the best buys for your dollar in the health sector. So I really appreciate this focus, and again, the opportunity to work with the Ministry of Health and with the Minister on this goal. Thank you.
Yeah, fantastic. Thank you very much, Madeline. I know that all the panelists, they have many things in their head that they want to share with all of us, but again, this session is very time sensitive. We only have 30 minutes. So I believe this is my final question for Ibu Endang. So Ibu Endang, with regards to the implementation of integrated primary healthcare or ILP, you know, it is very challenging sometimes when we are facing with diverse capacity across districts in our country. So my question for you is, what strategies have been proven successful in building the capacity of integrated primary health care in diverse districts across Indonesia?
Okay, so of course regulation and standard is important because then it gives clarity on how to do the integrated primary health care. But there is one ingredient that has to be there or otherwise it will fail, is that we have to work in an inclusive way. So, because otherwise it will not work. So, you have mentioned about the primary healthcare consortium, so thank you very much for all partners that have been supporting us through the primary healthcare consortium. Without you, I think we will not be able to accelerate, for example, 44 districts with momentum, and then also with Think Well and etc. Because then with partnership, we can drive the change from the field. So it's not always like idea from the top, but also the practice from the field actually drive the capacity very quickly rather than always doing things from the top. So being inclusive, not only with the international partners, but also with the through our district health offices, but also community with the Posyandu, with the kader, and also with universities. I think that's the only way we can quickly able to execute the integrated primary health care. Thank you.
Well, thank you very much, Ibu Endang. So, yeah, I think the time is approaching to the end. I just want to mention several important points from our panelists. So from Ibu Endang, she mentioned that for the successful ILP implementation, 3 drivers is needed. It's about the regulation, the changing from the curative to prevention, and then more outreach actions, and then lastly, it's about the integrated health services, and to improve the effectiveness, the implementation of LP, standardization and regulation is needed. Yeah, again, many apologize due to the time sensitive. I think we should end this, the first panel session, and again, give applause to our 5 amazing panelists. Thank you very much.
All right, thank you very much, Mas Wahyu, for moderating our first panel discussion. And also thank you, ladies and gentlemen, Bapak Ibu. You may return to your seat. Thank you once again. Please give a round of applause for our panelists and also our moderator on the first panel. We still have 3 other panel discussion. And before we start our next session or the next panel, let's get ready for a captivating art performance from 6 soloists. So we have 6 singers who each one of them have been traveled around the world to joining singing competition. But now they are together joined in an a cappella group. So without further ado, ladies and gentlemen, please welcome 6th Harmony a cappella.
Good afternoon. It's a little bit. Hope you had a great time, and yeah, we're gonna start. Please play the music. Thank you.
Hope you enjoy the music. Thank you.
If you know this song, we can sing along.
Yes.
Right? Can we clap our hands together? Come on. Hey. Ooh, hey.
Where the night has come and the lane is dark and the moon is the only light we'll see. No, I won't be afraid. No, I won't be afraid. Just as long as you stand by me. So darling, darling, stand by me. Oh, stand by me. Oh, stand by me. Stand by me. Stand by me.
If the sky that we look upon to tumble and fall, and the mountains to crumble to the sea, I will cry, I won't cry, no, I won't shed a tears, just as long as you stand by me. And darling, darling, stand by me. 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 Stand by me.
So darling, darling, stand by me. Oh, stand by me. Oh, stand by me. Stand by me. Stand by me. Whenever you're in trouble, won't you stand by me? Oh, stand by me. Oh, stand. Stand by me, stand by me, stand by me, stand by me.
Thank you.
Thank you.
Sixth Harmony. Once again, give your round of applause. So how is it, ladies and gentlemen? Shall we stay for the next performer, the next singer, or the next panel? Okay, before we commence the second panel session, we have the head of District Health Office, the province of Bali, Bapak I Nyoman Gede Anom, who will share the best practices of health transformation program in Indonesia districts to bring experience from the island of God of Bali. Ladies and gentlemen, please welcome Bapak I Nyoman Gede Anom.
Thank you. The Honorable Minister of Health of the Republic of Indonesia, Ministerial Representatives, Implementing Partner Representatives, Official Team of Ministry of Health of the Republic of Indonesia, and all meeting participants. Om Swastiastu. Assalamualaikum warahmatullahi wabarakatuh. Peace be upon us all. Namo Buddhaya. Ladies and gentlemen, health is a basic human right that the government has an obligation to provide various supporting facilities for health services for the community. One of strategies is the 6 pillars of health transformation, which are primary service transformation, referral service transformation, health resilient system transformation, health financing system transformation, health human resource transformation, and technology transformation. All the pillars are synergies and collaborate to achieve national health goals that are equitable at high quality throughout Indonesia. In the primary health transformation pillar, one strategy that is unique to Indonesia is Posyandu. Posyandu is a unit established by the community and for the community itself, which aim to provide promotive and preventive health services for child and elderly health. Posyandu are currently transforming into integrated activity to optimize the health of the community. Posyandu cadres also trying to provide home visit. This entire transformation certainly requires the support from all relevant parties and cannot be provided only by the government. In Bali particularly, Posyandu is held in its Banjar. Banjar is the smallest unit of indigenous community. Every month to provide its community and coordinate by the head of Banjar, namely Kelian Banjar. And the way to remind the community to attend Posyandu is also unique because they use kulkul as the reminder. Kulkul. Kulkul is traditional drum which is placed in each village in Bali. And from the role of Posyandu, Bali contributes to the best reducing stunting rate in Indonesia. Ladies and gentlemen, the COVID pandemic has taught us many things, including strengthening health networks. This collaboration involved expert, private sector, volunteers, and also the active role of the community itself. The collaboration led Bali to regain the world trust to revive the tourism sector that had fallen during pandemic. At that time, Bali also received a lot of assistance in health facilities and infrastructure from the private sector and even abroad. The partnership continues until this day, including in realizing health transformation. Bali collaborates with many networks. In the transformation of referral health, the Ministry of Health provides assistance to accelerate 9 priority services in regional hospitals. While the release One Health, Bali is also supported by NGOs. This shows that we collaboration goal can be achieved more rapidly and equitably. I hope this cooperation will continue in the future. So, ladies and gentlemen, at this great moment, I would like to thank you once again for the cooperation and collaboration. And also thank you for entrusting Bali as the host of this meeting. And don't forget to take the time to enjoy the beauty of Bali, the island of gods, the island of paradise. Thank you. Om Santi Santi Sati Om.
Right, thank you. Once again, please give your round of applause, ladies and gentlemen, for Bapak Inyoman Gede Anom, the head of District Health Office, the province of Bali, whose story tell us about the spirit to reactivate community-based health services, or also known as Posyandu in Indonesia. And right, we will begin our second panel. We have another theme of access and quality matters, most Indonesia hospitals and health talent transformation. And I want to call upon our esteemed moderator, Ms. Zakia Eke, a National Professional Officer from WHO Indonesia, who has over 8 years of demonstrated expertise in health workforce management, providing technical assistance to government and partners. Please welcome on stage Ms. Zakia Eke. Good afternoon, good to see you. And Ms. Zakia Eke will be accompanied by our key panelists. The first one, we have Director General for Health Service, Ministry of Health, the Republic of Indonesia, Bapak Azhar Jaya. Welcome on stage, Bapak. Thank you. And next we have Director General for Health Workforce, Ministry of Health, the Republic of Indonesia, who will be represented by Bapak Lupi Trilaksono, the Director for Quality Improvement of Health Workforce. Thank you, Bapak Lupi Trilaksono. And next we have Project Formulation Advisor, Japan International Cooperation Agency, Mr. Kawamoto Hanako. My apologies, Miss Kawamoto Hanako. Thank you, welcome on stage. And next we have the representative of WHO Indonesia, Roderick Layuk Salenga, Team Leader for Health System Strengthening. Welcome, sir. Thank you. Please have a seat. And last, we have Wiradianto Putro, lecturer at Politeknik Kesehatan Kota Pontianak, as beneficiary of the WHO grant. Please welcome on stage. Welcome, Mas Wiradianto. Thank you very much. Please have a seat. And I will let Ms. Zakia Eke to start our second panel discussion. Stage is yours.
Thank you, Mas Wahyu. Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon for ladies and gentlemen. So, in this session, as Pak Menteri previously mentioned, the 6 pillars of health transformation, the second session will address about the 2 emerging pillars of health system transformation. The first is about the referral system, and the second is about health talent or health workforce transformation. So as we know, there is no health without these 2 pillars, health facilities and also health workforce. Together with us, there's a very fruitful speakers from government, development partners, and also from the beneficiaries of program. From the government, we have 2 government. There's Pak Azhar atau Pak Aco, so DG of Health Services, and from representative of DG of Health Workforce, Pak Lupi, thank you for coming. And also for the development partner, there is JICA, thank you for coming. And also from WHO Indonesia. And in the last session, we also want to hear what the beneficiary says about the program. So thank you for coming, Bapak Adit from MOH Politeknik Kesehatan Pontianak. So we can start this session with Pak Aco. About the challenge, Pak, the challenge that you face in the health service facilities. Can you explain more, Pak, about what is the challenge and what we need to support you in this effort? Thank you.
Yeah, thank you. Good evening, ladies and gentlemen. I'm so sorry if my English is not good, yeah, but I hope so you understand what I mean, yeah. I think we have a 4th challenge in improve our health services in Indonesia. First, geographical divided. We know Indonesia have then 14,000 islands and 270 million people. Because we are archipelagic country, we have we have a lot of islands in the remote and rural area, often lack adequate infrastructure and health facilities. This is the first problem, the first challenge. And the second challenge, lack and unequal distribution of health facilities. If we compare with Malaysia and Singapore, they have 1.5 until 1.5 and 230, 1.5 until 3 bed for 1,000 people. Indonesia only have 1.2 for 1.2 bed for 10,000 people. And for the unequal distribution, I give you information that more than 75 health facilities are in the western of Indonesia. Yeah, in 30% hospital is the eastern of Indonesian region. And the third challenge is health infrastructure and resources. Limited healthcare infrastructure, including hospital, clinic, and medical equipment, and health training, health personnel, is a significant challenge. There are a shortage of health workers, especially in remote area, which impact the quality of accessibility of health services. Maybe Pak Pujo can let more detail. Yeah. And then the health information system. That is the next challenge. Inadequate health information system and technological infrastructure can create a challenge in patient recording, data management, and communication between health facilities. They are impacting the continuity and quality of services. And the last, burden of disease and public health challenge. Indonesia faces various public health challenges, including infectious disease such as malaria, TB, and dengue fever. Non-communicable disease such as cancer, stroke, diabetic, and cardiovascular disease, as well as maternal and child health problems. Addressing these diverse health problems requires a multifaceted approach and adequate resource. I think the 5 challenges we must improve for health services. Thank you.
Thank you so much, Pak Acho. And also we will moving forward to our donors colleague, Ibu Hanako from JICA. Based on the challenge that Pak Acho mentioned before, what JICA did to support MOH in the hospital area?
First of all, thank you so much for inviting this important meeting. I'm really honored to be a part of a panel too. Thank you so much. Let me answer the question regarding to how we can contribute to improve the services in hospitals. I would like to use the telemedicine system as an example. So during the COVID-19, everywhere in this world, including Japan and Indonesia, have faced huge challenge providing care for continuously increasing number of patients under the strong restriction of movement. At the time, JICA closely worked with Ministry of Health and Ministry of Education, as well as private partners in the field of ITs, worked together to install the telemedicine system in several ICUs under the university hospitals, connecting Japanese hospitals so that the Japanese doctors, nurses, or medical engineers can provide teleconsultation while staying in Japan, which resulted in many patients with serious conditions staying in ICUs be able to receive a timely and proper care or treatment in Indonesia. And not only that, even after the pandemic, we realized that this telemedicine system is now used between higher hospitals and lower hospitals for a teleconsultation, which helped reducing the number of unnecessary referral of patients. So I could say that this model of collaboration with G2G, or as well as private and private and public collaboration, have proven sustainable in improving services in hospitals. Thank you.
Thank you, Ibu Hanako. And also, we know that the collaboration between DG Yankes and also JICA is about telemedicine to closing the gap of remote area in Indonesia. And also, we will moving to the health talent transformation, or the 5 pillars of health transformation. So, Pak Lupi, what do you think? What is the challenge that DG HRH forced to maintain or to success about the health workforce in Indonesia?
First of all, thank you very much, MC, and also very good afternoon, everyone who are attending here for this prestigious moment. Yeah, currently there are 3 biggest challenges in our healthcare workers, pillar that need to be overcome. The first, like Bapak Azhar also said, that we have a national health worker shortage because of our geographical is also very wide, and also some part of our Indonesia still have a remote area. We still need more doctors and 9 type of health workers priority. And right now the ratio of doctors is currently 0.54 per 1,000 population. Is still low compared with the others similar ASEAN countries and also other countries. The second is the distribution of health workforce is uneven. Like Bapak said also, there are many uneven between the eastern part of Indonesia and also the west part of Indonesia or in the middle part of Indonesia. Many health workforce, especially for the 9 type of the health workforce that we need, they are kind of avoiding the eastern part of Indonesia. They tend to just stay in the central of Indonesia or west part of Indonesia. That's why distribution is uneven. That's why we are trying to make a kind of incentive to make also their retention in their task is stay there. That's why we are also, need to have a good, initiative and pursue them to stay in the some part of Indonesia that not everyone want to stay there. And the last is the lack of the competency-based quality or training that need to be enhanced. And the level of competency-based assessment, training, and lack of the access to the accredited institutions is an issue of the, how to improve the quality of the, or the continuing also for the professional or medical professions. That's the 3 main challenges, what we call it, or we can say also the obstacles that need to be overcome. Yeah, thank you.
Thank you, Pak Luffy. So we know that there's 3 main challenges, also the shortage, uneven distribution, and also the lack of quality. So I will invite our colleague from WHO. Maybe you want to share the collaboration to closing the gap mentioned by Pak Luffy.
Thank you very much, Eke. First of all, I'd like to say good afternoon to all of you. And let me start by saying I think the intermission number song earlier is really fitting because it has to be mentioned that we really appreciate the Ministry of Health for standing by the people of Indonesia, standing for them. And I'm sure that the partners across in this room share the sentiment that we will continue to stand by the Ministry of Health in pursuing the health transformation agenda. For WHO, being the UN Specialized Agency for Health, we have varied programs across different thematic areas. And in health system strengthening, many of you would know that we have the systems building block, and one of the building blocks is the human resources for health. In our understanding, no system for health will be functional unless you have health workforce. Therefore, there will be no universal health coverage if there will be no sufficient, adequate, competent, and quality health workforce. So it is indeed a priority for WHO to support the member states in order to upgrade, upskill, and make sure that we have the right match and mix of expertise and available workforce for the needs of the people across the world. In Indonesia, I think many of us would agree, as mentioned by DGHRH, there are 3 major issues: production, distribution, and of course we have to pay attention to quality. And this is precisely the reason why WHO is looking into these 3 areas. And we're very proud to mention that as it will be shared later on, we have a very strong partnership with the DGHRH in several areas, and I'd like to make mention of some of them. First of all, we want to make use of data because data information is very important for us to be able to evidence our action in terms of priority and program planning. And that's the reason why we have extensive support in terms of the SES DMK or the HRH information system, which would basically give you an idea how much we have, where they are, very important in terms of forecasting as well, particularly when we talk about the 9 essential health workforce for the service delivery in across Indonesia. Second, we're very happy also to support the Ministry of Health in terms of assessing competencies of certain health groups or health professional groups. This year, we've done specific ones for midwifery, and we've done another one for nursing, which are priority health professional groups for Indonesia, especially when we talk about primary health care. The third thing I would like to mention is that we're supporting Poltekkes, particularly because we look at the pre-service training as a critical input to drive the health outcomes targeted by the government of Indonesia. We believe that if we have the competent workforce, which are of course prepared, educated by the right tools, then they will definitely be able to help us drive the agenda for health, enable us to drive the programs so that people will have the capacity to reach the targets, whether it's subnational or at national level. Our work in the Poltekkes is basically around increasing the competency of our nurse educators. Our colleague will be able to mention this later. This is pertaining to development of modules in different thematic areas, and then also increasing the capacity of our lecturers and educators so that we will be able to prepare not only for domestic use or for domestic needs, but enable our Indonesian workforce to contribute to addressing the global shortage of human resources for health. And then finally, of course, we'd like to mention that this is not going to be the end of the partnership, because we already had discussed extensively with DGHRH in terms of the next biennium for the next 2 years, the priorities in this area. And we're very much interested in supporting continuing professional development. We're discussing about the support that can be put into Pelateran Sehat, looking at that potential in order to reach even those workforces that are in very far-flung areas so that the quality will continuously be improved. And lastly, we'd like to mention that, of course, the way we approach it, because when you look at the health labor market, there are different stakeholders, and this is an invitation to other partners as well to look into how we can support and how we can work together to push the HRH agenda of Indonesia. Because when you look at it, it's not just about the health system. We're also now looking at how we blur the distinction between the academic system and the health system, because international literature would tell you that if you're able to work on those two together, then we will be able to address more definitively the HRH agenda of the country. Over to you, Eke. Thank you.
Thank you so much, Prof. Eric. And now we can hear directly from the beneficiaries of the program. We invite Pak Adit from Moh Poltekkes Pontianak.
All right, thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, everyone, every college, and all participants of Indonesia Health Partners Meeting. My name is Wiradianto Putro. You can call me Adit. I work at Poltekkes Pontianak, also called Pontianak Health Polytechnic. It's in Borneo Island, in upper part of the archipelago. So in this occasion, I would like to share my thoughts and my experience as a beneficiary of the WHO program in collaboration with Indonesian Ministry of Health. The program is called English Camp and Nursing Book Development. So the program, if I'm not mistaken, it was held in Bapelkes Salaman, Magelang City, Central Java, from 5th to 12th June in 2023. The program consists of 20 participants, mostly are lecturers from different health polytechnic across Indonesia. It's from Poltekkes Medan, Poltekkes Pontianak, Poltekkes Yogyakarta, and Poltekkes Surabaya. So, to respond to the needs of professional health workers, the health polytechnic or Poltekkes must be able to prepare their students to be qualified health workers that can compete across the world. And then I think this program is an answer to the challenge due to the quality program. Is the purpose of the program is to improve the quality of education in Health Polytechnic in particularly. And then the activities during the English camp program provide us with knowledge, skills, and even attitudes we need to provide to optimal learning process to the students, to give optimal learning process to the students. During English camp, we are taught how to teach properly, how to write a book properly in English, and nursing specialty in particular. And based on the program, we have already 20 books published with ISBN for 20 subjects in nursing. This is one of the book, Pediatric Nursing, the one of the book that produced from the program. There are 19 another book. Me myself made a book of diet and nutrition. That's why I'm skinny. Yes, there are 20 books with ISBN. And then the book now can be used as learning material in Health Polytechnics. On behalf of program participants and lecturers of Health Polytechnic, we would like to appreciate to WHO. Thank you, maraming salamat, sir. Yes, I learned a lot of Philippines Tagalog, right? Thank you to the WHO and the Ministry of Health as well for giving us opportunity to learn or to develop our skill in order to provide optimal learning process to our students. And we hope the program can continue to improve quality, sir, of education in Health Polytechnic in order to prepare qualified healthcare workers that can work globally. I think that's all for me. Thank you very much.
Thank you, Pak Adit. We can give applause to our beneficiary. And to give the context, the English camp is the part of the faculty development for pre-service training as the preparation that MOH will be opened the international class in the next year. Okay, we go to the last part of this session, Pak Aco and Pak Luffy. So we know from the panelists that there is something that already collaborated this year. So what next in the coming year? What support that you need in DG of Yankes for leveraging the Indonesia Health Service Facility? Thank you.
Thank you. The government of Indonesia is always involves all stakeholders in formulating policy related to hospital, so they get comprehensive input and are able to implement them. Of course, we need collaboration with donor support, NGO, to help us to implementation our policy to improve health services in Indonesia. Currently, in order to increase access and quality of service, the government is also opening up opportunity to private sector to build our health services, our health facility. Investor with foreign capital participation can now invest in establishing hospital throughout Indonesia up to 100 capital be opening. And I think that is we hope for the next collaboration. Thank you.
Thank you, Pak Aco. And we invite other donors or development partners to chip in the program or support that needed by Dirjen Yankes. And also we're moving forward for DG HRH, Pak. So what do you think the next step, the scalability and the sustainability that we will build to support the DG HRH in terms of other development partners?
Thank you. Just like WHO also always said that we have a good collaboration with WHO for several years and continuing each year. And like in Indonesia, especially in our health workforce pillars that need to be escalate or to be need to sustain, we are developing right now the learning management system is integrated and comprehensive learning management because I'm in the directorate of the quality improvement of the health workforce, so I'm concerned how the training, the webinar, and many kind of the action to enhance the competency of the professional or the health workers need to be increased. That's why the availability of the access and also many type of kind of the training and the webinar or the seminar that need by the health workers should be inclusive. That's why the using of the Pelataran Sehat, we call it our learning management system is the Pelataran Sehat, need to be enhanced and escalate each year. Right now, there are many needs, many type of the MOOC, if you know, the massive online system for the training that need to be many type of the, the skill and for the health workforce. That's why we would like to increase our content, escalate our content to reach more health workers or health workforce in all part of Indonesia. That's one thing. And then also, in terms of the shortage of the the health workforce in part of Indonesia, we are very happy if the donors or the NGO can support us to give us of kind of fellowship for the specialists or subspecialists to fulfill the gap between what we are right now. That's why what we are intend to say this. Thank you.
Thank you, Pak Lupe. And still need room for collaboration, Pak Lupi, for other development partner to support the DG HRH. And also for the development partner, we would like to get the closing statement from you both. So maybe we will hand over to Pak Eric and then Ibu Hamato then. So what is your thing about the scalability of the sustainability of this collaboration?
Thank you. I think looking at the structure of Poltekkes, given its geographic reach, it is really a very promising intervention, considering that there's structure, there are people, and there are systems in place. What we need to do probably is to continuously support them in terms of enhancing whatever they have at the moment, with emphasis on key priorities and key interventions. And that's the reason why I think dialogue between the Ministry of Health and development partners will always be crucial so that we know that we are addressing the real needs on the ground. Second, I think many of us in Indonesia are really amazed with the many examples of good practice. I'm speaking for the rest of Southeast Asia, for example, looking at many good practices done in the country. I think it's important that we document and we enable others to sort of scale this up or implement this in their own systems by making sure that the tools, the expertise, and then also the provisions for coaching and mentoring are available. And finally, I think what is also important is, again, to recognize because this is for human resources for health, I'd like to make use of this opportunity to thank the commitment of our health workforce and our educators, because again, from our side, we really think that the academic system and the health system should really work together. So making sure that we always recognize them in whatever form that would be, whether it's incentive or not, financial or not, the point is we are able to recognize and celebrate the heroism of our health workforce and our health educators. Thank you.
Thank you. Ibu Hamato?
Thank you so much. As Parupi and Director General mentioned, there are several challenges, and I'm very excited to know that we have more collaboration to come. And because we are running a short time, just to pick up one topic I would like to mention in terms of the shortage of the health workforce. I'd like to use countermeasure strategy for the aging society as an example. As you may already know that Japan has facing many challenges in relation to the aging society, which Indonesia will soon need to prepare for. So, as JICA would like to establish a stronger connection with relevant government entities and educational institutions, and of course the field such as hospitals and facilities to develop the regulations or to develop the health workforce for elderlies, and of course develop healthcare educations. And with these collaboration, we are hoping that we can provide a very practical experience for Indonesian workers or government staffs to equip themselves to be able to provide proper care for elderly.
So applause for all our panelists and beneficiaries. So the time is over. So to close this session, thank you so much for Pak Aco, Pak Lutfi, Bu Hanako, Pak Eric, and also Pak Adit. We can hand in hand in the next year to support more on the health service and also health workforce, and also inviting other donors and development agencies to support all the pillars of health system transformation. Thank you so much. Okay, we can close this session and over to MC. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ms. Kia AK, and all the panelists. I strongly believe with all the effort have been done and doing by our panelists on the second panel, the quality of Indonesia's health will be even better in the next few years with the help of fund from the donors, of course. Right. Thank you. Once again, please give a round of applause for our moderator and also all panelists in the second panel. Right, ladies and gentlemen, next I will invite our next speaker before we commence the next panel, the third panel. That recently the Ministry of Health has signed an MOU on building the cardiology hospital in Surakarta City or Solo in Central Java. And together with the government of the United Arab Emirates. And we are thankful today to have Ms. Shaima Al-Habsi, Deputy Head of Mission UAE Embassy in Indonesia, to elaborate furthermore on the project. To Ms. Shaima, please come up to the stage, ladies and gentlemen.
Assalamu alaikum wa rahmatullahi wa barakatuh. And Salamat Suri. I would like to express my gratitude to the Ministry of Health of the Republic of Indonesia for inviting the United Arab Emirates to participate in the first Indonesia Health Partners meeting. And what a lovely way to start the week in Bali, right? Indeed, it's a great honor to be part of this meeting, as the UAE and Indonesia are close friends and strategic partners in various sectors, including health sector. In supporting Indonesia's efforts to transform its healthcare into accessible and high-quality public service, the UAE and Indonesia laid the groundbreaking for the construction of Emirates Indonesia Cardiology Hospital in Surakarta City, Solo, Central Java, to overcome heart problems as the #1 cause of death in Indonesia. This hospital would be the first modern cardiological center in Indonesia to be equipped with advanced technology and innovative healthcare models. We in the UAE see many potential and opportunities to collaborate with our Indonesia partners to create a self-resilience and develop affordable healthcare services. Indonesia has laid the legal foundation to attract both investment and talented medical and healthcare providers by issuing the so-called Omnibus Health Law in August 2023. This important step will pave the way further for the collaboration between our nations and the world. To conclude, I would like to assure that the UAE government, through its embassy in Jakarta, are ready to work with you all to facilitate communication and engagement between both public and private sector to identify potential investment projects in the healthcare sector in Indonesia. Thank you.
Right, that was a video about the cardiology hospital in Surakarta city in central Java that has been explained by Ms. Shaima. Thank you, Ms. Shaima. And next we have another major grant project from the government of Japan to distribute mobile X-ray for 102 hospitals across Indonesia. Please watch the following video.
Pada tahun 2022, Jepang memenuhi komitmennya mendukung Indonesia di bidang kesehatan dengan melakukan hibah mobile X-ray ke 102 rumah sakit di Indonesia.
Dengan keterbatasan yang ada, kita tetap melayani pasien COVID karena mereka mau kemana lagi kecuali ke rumah sakit.
Kalau kendala di radiologi sendiri, pertama saat COVID itu datang tentu saja pemisahan ya antara pasien yang tersangka atau positif COVID dengan pasien yang tidak COVID.
Nah, jadi kami butuh peralatan medis yang bisa digunakan oleh pasien-pasien isolasi tersebut.
Dari segi mobilisasi juga jauh lebih mudah karena kan alat ini bodinya bisa kita putar 360 ya. Terutama untuk pasien-pasien yang di kanan kirinya itu banyak aksesorisnya kayak gitu. Nah, kalau pakai alat yang lama kita jujur memang jauh lebih sulit ya karena kan dia berat. Nah, kalau alat ini karena dia mudah dioperasikan dan diputar kayak gitu jadi memang lebih mudah.
Teknologinya cara langsung jadi gambaran ketika kita melakukan ronsen, jadi kita langsung bisa melihat gambar yang setelah difoto dalam hitungan sekian detik gitu.
Terobosan teknologi mobile X-ray ini diharapkan ke depannya dapat menjadi jalan keluar bagi upaya peningkatan kualitas pelayanan kesehatan di penjuru Indonesia. Bahkan hingga ke daerah terpencil, pulau-pulau terdepan Nusantara.
Tentu alat ini sudah pasti tidak akan istirahat ya. Alat ini namanya radiologi mobile ini alat yang sangat penting di rumah sakit manapun, apalagi sekelas RSCM.
We are truly very grateful for the government of Japan that provide through this device. It's set to significantly enhance our patient care by providing diagnostic and streamlining the process of our care.
本 ODA によりインドネシアの医療従事者、それから医療現場、そして導入先の病院の住民の方々に広く使われていることを知り、大変嬉しく思います。本プロジェクトがインドネシアの医療制度の向上の一助になることを切に願っています。
Meski jarak Indonesia dan Jepang berjauhan, kolaborasi dan komitmen ini menciptakan kedekatan yang berkelanjutan di antara kedua belah pihak. Demi masa depan yang lebih sejahtera.
Terima kasih.
Thank you. Arigato.
Right, ladies and gentlemen, let's give our highest appreciation once again to the government and partners in supporting health transformation in Indonesia. Right, let's move on to our third panel with the theme of Towards Indonesia Health Resilience and Technology Innovation. Guiding us through this enlightening session is our esteemed moderator, Ms. Ati S. Anartati from the Clinton Health Initiatives. Please welcome to the stage, Ms. Ati. Right, we'll be joining with Ms. Ati on the stage, our three panelists. The first one, Director General for Pharmaceutical and Medical Devices, Ministry of Health, the Republic of Indonesia, Ibu Lucia Rizka Andalusia. Ibu Rizka, please welcome on stage. Have a seat, Ibu. And also we have the Chief of Digital Transformation Office, Ministry of Health, the Republic of Indonesia, Bapak Setiaji, who is unable to join us on the stage today, but he's with us online. Can we say hello to Pak Setiaji?
Hello.
All right. Good afternoon, Pak. Apa kabar? And next we have the representative of Gavi, Alice Nader, Senior Country Manager of Gavi, who is also joining us online. Right, welcome in Bali from online, Ms. Alice Abu Nader, who's joining us online. And next, there are two seats available on the stage. So I will call the representative of UNICEF, Brunel Shetty, Chief of Health Section, UNICEF Indonesia. Welcome, sir. Good to see you. And last, we have Kisje Pontororing, Head of the Disease Prevention and Control Division of the North Sulawesi Provincial Health Office as beneficiary of HPV vaccine introduction by Gavi. Please come on stage, Ms. Kisje. Right, welcome once again our panelists who are joining us on the stage, and two from Zoom or online. So I will let Ms. Ati to start the third panel discussion.
Thank you, Mas Wahyu. Ladies and gentlemen, distinguished guests and the esteemed panelists, both offline and online, Pak Setiaji and Alice. A very warm welcome to all about the panel 3 about the two-word Indonesia health resilience and the technology innovation. So we will discuss deep dive into the intersection this health resilience and also the technology innovation. We will cover about 3 topics, which is the lesson learned from the health resilience during the COVID pandemic. And then secondly, about how the role of technology to support the health resilience and also the best practice directly from the beneficiary. So maybe the first question to Ibu Rizka. We heard that previously that the minister launching about the 6 transformation pillar, that the health resilience is the 3rd pillar, play a critical role and important role during the COVID pandemic. So, Bu, what is, maybe you can explain, based on the experience of the COVID-19, what the key lesson has the country learned regarding the health resilience?
Yes, thank you, Bu Ati. Yeah, as we know, we all around the world, especially Indonesia, has learned several key lessons from managing the last pandemic, COVID-19, concerning in the health resilience. We have at least 3 important learning from the pandemic situation. The first one, the importance of having sufficient national capacity for research. When the pandemic hit, we realized that Indonesia was very limited in research capacity. It had been confirmed that we were left behind in terms of the number of sequencing pathogen being conducted, and also the number of vaccine development, research and development being succeeded, and the number of clinical trials being conducted, especially for the medicine and vaccine and also the medical devices for tackle the pandemic. This limitation prevent this nation from obtaining innovation promptly to tackle the COVID-19 pandemic. The second one, the importance of having sufficient national capacity to product development and manufacturing. When the pandemic hit, Indonesia was left behind in having sufficient access to COVID-19 vaccine, medicine, and also the medical devices. Some of the essential medicine for the COVID-19 treatment should be imported from other countries, and medical devices are quite the same. We are still heavily rely on imported product, especially when the pandemic begins. When the vaccination program started in several countries, Indonesia should be waiting for supply from other countries like from the China, Netherlands, France, UK, US, and other donors. This has limited us to protect people and made vaccination intervention more challenging. The first vaccine, we have a CoronaVac from China, and we start to vaccination in January 2021. We also limited in developing and manufacturing product, making us dependent on foreign support for vaccine. Before this nation was able to produce vaccine by local pharma company and granted marketing authorization in December 2022. It is the first local manufacturer produced the vaccine for COVID-19. The same condition also happened in medical devices, where this nation needed a longer period of time to produce the medical devices like in vitro diagnostic, PCR reagent, ventilator, and other medical devices for tackle the COVID-19 pandemic. And the third one is the importance of implementing a digital system in the supply chain. Maybe Pak Setiaji will explain more detail about the digital system. We learned a lot about the implementing supply chains that support COVID-19 pandemic management in managing a multi-platform vaccination logistic in real time. Information system are used to obtain a complete and valid picture of vaccine availability and vaccination supporting logistic through our system, SMILE, from UNICEF, from UNDP and ASIC. Through the system, we are able to obtain real-time data for vaccine availability, quality, and its utilization, which drove the decision-making process in managing vaccination. This has enabled Indonesia to achieve great result on COVID-19 vaccination, where we are able to vaccinate the target population within the time frame mandated by WHO. We believe that those lessons were too valuable to be ignored, and it is important to build more robust health resilience strategies aiming to improve the overall healthcare system and to provide people with more resilient healthcare system. We learning from our last pandemic experience that build health resilience should be proactive, sustained, and inclusive program. And this program should be run based on the clear identification on several areas that needed to be strengthened, fueled by sufficient resources, including regulation, and engage multi-stakeholder participation. To support our health technology, we also started to build the more advanced technology, such as genomic technology, because as we know, during the pandemic situation, we also have to build our capability in the sequencing of the pathogen. So start from last year, Indonesia started to the project in the genomic program, and we plan to build the national biobank and national gene bank, aspire to generate 10,000 whole genome sequence data from patients in 2022, and comprehensive biobank pivotal, ensuring an exclusive capture Indonesia genetic diversity. The gene bank facility will also serve a valuable tool and resources to support national program consisting of 2 studies conducted in parallel, general population study and patient group study. So the expected outcome from the utility of gene bank is the establishment a comprehensive genomic health database empowering local stakeholders to drive innovation in vaccine, medicine, therapeutic, and treatment protocol. I think learning from the pandemic situation, there are many innovation from Indonesian healthcare and in the technology of healthcare technology.
Okay. Yeah. Oh, fantastic, Ibu. Yeah, because you already mentioned about the intersection between the health resilient and also the innovative technology. So I will move to the second panelist. Pak Setiaji, good afternoon. Can you hear me?
Good afternoon. Yes, clear.
Okay. Yeah, thank you, Pak Setiaji. Listen from Ibu Rizka that during the COVID-19 pandemic, technology innovation play a crucial role in various aspects in the public health and also in the crisis response and also in everyday life of the Indonesian citizen. So as the Chief of Digital Transformation Office, Pak, how has technology play a role in building health resilience in Indonesia, especially during the challenging time when the COVID pandemic?
Yeah, okay, thank you. Good afternoon. Sorry, apologize, cannot join offline. Continuing the explanation from Bu Rizka, technology itself is a very important roles, especially during the pandemic. We have learned a lot from the pandemic, especially for digitalization. So from technological perspective, we have several problems, starting from difficulty of getting real-time data. Mostly the data coming from our system is delay data. because the system itself is some of system manual and also some system but not integrated. Because of that, we have some delay input. And then the other side is most of health data is aggregate rather than raw data and also inconsistent. Yeah, the country's health data is dispersed across diverse platforms, which includes various formats and also large volumes. Yeah, because of that, Ministry of Health learned from this pandemics. We built the platform now to gather all the data from the health facility to make sure all the data can integrate it and have some similar standards. And then based on the technology, we have some example how the future's technology is very important in the futures. For example, like Bu Rizka mentioned about the biotechnology, it really can help not only design and discover vaccine components such as antigen proteins, which can stimulate the body's immune system to fight disease-causing pathogens. And also technology also help produce vaccine using genetic engineering techniques, DNA or RNA. And then another example of application of big data and AI, especially for accelerate infection monitoring disease and also to build a medical diagnostics for testing more faster. For example, like COVID, before we have when the first time COVID-19 for the testing itself need more than 3 months or 1 month. And then after that, after we have some new innovations, now we can detect more faster, only 10 minutes. Because of that, we believe the technology can improve the diagnostic more faster. For example, like a TB, usually we use like Ronson, so we can use the AI to interpret the images more faster to make sure this patient is got TB or not. And then also we can building the early detection for outbreaks, and also we can build like disease prediction using our data. And then we also can use like for IoT. For example, IoT is Internet of Things, so we can get data real time without human intervention, because for human input, sometimes the input is false. Yeah. For example, like COVID, many citizens complain the result is not positive, the result is negative, but the people input this positive. Because we have integrated system, so the citizen can directly data coming from the labs using the Peduli Lindungi. And then we also can use this, for example, to monitor the vaccine temperatures, because it's very important thing to manage or to keep the vaccine still on the temperatures. And then also we can, for example, monitoring the vital signs from critical patients using the smartphone, smart devices, or many devices can directly give us the information to the centers, especially for for what we call this national common centers. This is some of example how is very important the technology in the futures.
It's a lot of me. Okay, thank you. And we move to the next panelist, Alice, representative from Gavi. Yeah, to give you a context, Gavi is a global partner that focus on increasing access to the immunization. And in the case of Indonesia, Gavi has played a significant role in for the country for the immunization effort. So Alice, from your global perspective, how is Indonesia building its health resilience through technology innovation? Floor is yours.
No, thanks so much, Dr. Atik. Can you hear me okay?
Yes.
Great, and good afternoon, esteemed colleagues, and please accept my apologies for not being able to attend personally and participate. However, it's a pleasure to be able to participate in this enriching discussion online, and I would like to thank all of those that have organized this meeting to accommodate my participation. So thank you very much. From a global perspective, I just want to add what my colleagues have already mentioned, Ibu Rizka, as well as Pak Sejaji, and apologies for miscommunicating your name, but all this to say that the implementation of digitalizing and operationalizing systems such as SMILE has been able to support Indonesia in its ability to successfully deploy upward of 2 million doses daily. That's a very significant volume for what was initially being deployed in routine immunization. And being able to also manage those volumes, not only from multiple vaccine sources such as COVAX, bilateral agreements, donations. The government has been very successful in reaching or immunizing its target population. Ibu Rizka's lessons learned we perceived the government's response in a very positive way. It was very refreshing to see Ibu Rizka identify challenges as well as solutions. And I want to reiterate and echo all of the government's ability in being able to gather the lessons learned from COVID and being able to operationalize and quickly identify the areas that they are in the bottlenecks for successful implementation of the vaccine. Just to include the operationalizing, SMILE has been able to give the government real-time ability to visualize the vaccine supply at centralized and decentralized levels. It also gives the government the ability to use this management tool to ensure that there is no immunization opportunities lost, and also to be able to tailor immunization service delivery at different levels to address those needs. Through Gavi or Gavi support to UNDP, and I don't want to speak on the behalf of UNDP colleagues that have done the heavy lifting, but through 3 different grants of Gavi, we've also been able to digitalize or expand the digitalization of the cold chain equipment through remote temperature loggers, which do move the management of the cold chain from a paper-based system to a paperless system, also giving colleagues a real-time assessment of the vaccine and its handling as well as its quality assurance. And so we're hoping that after the complete implementation of the grants that have been provided through the post-transition grant, as well as COVAX, CDS, and the middle-income country strategy, we'll be able to move what is currently the coverage of approximately 45% of health facilities to about 94% to have these remote temperature loggers. And so we're hoping that by digitalizing a lot of the cold chain management, that we're able to support and better equip the government in being able to quickly identify bottlenecks and do these course corrections. One thing I also wanted to reiterate is not only has the government been able to very agile and successfully adopt technology to roll out COVID-19 vaccines, but I think that it's important to reiterate the big success in being able to operationalize the COVID-19 response and vaccine delivery through the tremendous amount of country ownership and leadership. I think in panel one of our colleagues had mentioned that a big challenge that we have as partners is being able to keep up with how quick the government is. And we did see that post-pandemic, these efforts were very significant in having about a 13% DTP1 coverage in WENEC from the Beyond campaign. So all this to say that one of the things that we've learned in seeing the response from COVID-19 is not only has the successful adoption of technology been important for improving quick service delivery, but also having that government leadership and dedication is very important and also has been vital. And we already see the results through the implementation of Beyond campaign and as well as a 1-year increase in DTP1. So all this to say that the efforts of governments and implementing partners does show a significant and very swift recovery. In addition to operationalizing 3 new vaccine introductions within a 12-month span, as well as the expanded introduction of IPV2 and JE in endemic areas. So all this to say that the importance of country ownership and leadership is also vital, I would say, for successful rollout. As well as the diversification of vaccine supply. It is true that many countries, unfortunately, didn't necessarily have quick access to the vaccine, us at COVAX as well. We saw a slow vaccine supply in the first Q1 and Q2 of 2021, which thereafter had a surge the second half of the year. However, I can say that Indonesia has been extremely successful in managing the vaccine forecasting, as well as diversifying the source of the vaccines. And thereafter also with Innovac been able to have a tech transfer. So from the experience that Indonesia has had with COVID, as well as the way that the country has responded to the pandemic, was very refreshing and exciting to see how fast the government was in being able to manage all these vaccine sources and all these vaccine volumes, but also recognizing the need to ensure sustained and resilient vaccine supply, and has successfully operationalized the tech transfer. So I would like to echo what my colleague had mentioned in the first panel, saying that country ownership and leadership is very important and has to be congratulated, along with the fact that it's a pleasure to coordinate and to work and support the government as well as implementing partners in all of its efforts and dedication in strengthening routine immunization. And we can only try to catch up. So thank you, and back to you, Dr. Atiq.
Thank you for your insight, Alice. Now I'm moving to Mrunal as a representative of UNICEF. Considering UNICEF focus on child and maternal health, how can the lesson learned be translated into strategies that enhance health resilience? So, floor is yours.
Thank you, Ibu Atiq, for the question. And before I start, thank you to the organizers for giving this opportunity to UNICEF to come and share their thoughts. I think we can all agree that COVID-19 was a period of a lot of despair and loss to almost everyone, if not actually everyone. But on the flip side, it was also a great opportunity for innovate and accelerate some of those innovations. I think Indonesia seized its opportunity very well in this gloomy context, as it piggybacked on existing innovations and accelerated on certain ones. I can, from UNICEF standpoint, from maternal and child health, I can narrate at least a few offhand. The entire space around social listening to understand how best vaccine acceptance or misinformation was moving around in the digital space. The use of WhatsApp-based chat boxes to give authentic, clean, and clear messages to people who are involved, both in the giving the vaccine side as well as those who are receiving, need to receive information. I think demand generation is another big example on where the digital space was very, very useful to bring this 86% plus COVID vaccination, 86% plus COVID immunization rates, to be actually for making it happen. But I would stress on one specific one, and which is known as, by its acronym, ASIC, which is an application for getting immunization records, all in a very unique way. Unique in the sense it's linked to the unique identifier, the unique citizen ID card, a unique number, and therefore it's a unique record. During the pandemic, it helped get all of the data and helped in tracking who are the ones who are falling out of service. And actually, this was quickly expanded during the catch-up immunization we call as BEYOND, where I mean, we had the unfortunate privilege of being the third largest country of zero-dose children, but throughout the efforts of the Beyond campaign, we rapidly declined to almost seventh. A massive campaign led by the MOH led to now hardly 500,000 children who are yet to receive a single dose of vaccine. So I think the digital technology played an important role in this. ASIC, while used in the field of immunization, has the potential to move much more beyond the field of immunization. And the UNICEF team, along with the Office of the Digital Transformation and the Ministry of Health, is trying to see how we move from immunization to nutrition as a first step. Yeah, and from nutrition moving onwards into antenatal care, overall growth monitoring, expanding through further modules into non-communicable diseases, mental health. Okay. So once you have an individual health record or linked to a unique identifier, the potential of expansion is endless. It is depending, what your capacity is and what your appetite is. Okay. So I think there is a great scope that some of the innovations that were made in this space can really move ahead. I think I think I'll stop there because I can see the clock ticking. It's just 4 minutes more, and we still have one more colleague to speak.
Thank you, Bruna. So the last panelist, Ibu Gisha, as you are considering your direct involvement in during the COVID-19 pandemic in North Sulawesi, as the direct beneficiary, so how is COVID pandemic experience can be translated and updated to the HPV national scale up?
Thank you. Yeah, we've learned several key lessons from COVID-19, but I want to highlight what we've learned from our COVID-19 vaccination program. Mm-hmm. We realized that strengthening the vaccine delivery system is crucial in response to COVID-19 pandemic. So this involved implementing several strategies. First, we have to work quickly to adapt that changing circumstances. We have to be agile to implement the vaccine policy. And we have to effectively collaborate with various government levels and health facilities. And also we have to develop and implement communication strategies to address vaccine hesitancy and misinformation. We have to improve our public education campaign and engage with community or religious leaders to build trust in vaccine. And also, we improved our distribution network. We work closely with district government to make sure that there is equitable vaccine availability all across districts in North Sulawesi. And we learned that we need good cold chain system, and thanks to Gavi, we have a cold room and ultra low temperature freezer. So this help us to ensure our vaccine quality, and also we can have more storage space for another new vaccines. And lastly, we need strong commitment from local government to comply with the reporting system using the digital vaccine and cold chain monitoring application, the SMILE app. So this is very important. So we can have real-time data on the vaccine logistic. And these strategies are very useful for us when we are now scaling up the introduction of new antigen, including HPV. Now we have better supply chain for vaccine, but we are still working on the demand side. The vaccine hesitancy, we still find that. And also we observe that the involvement of other sector, especially education sector, still need to be improved so that we can work together, because the HPV is part of BIAS, the children school age month for vaccine immunizations. So we need support from education sector. I think that's all.
Thank you, Bu Gisha. Yeah, time approach to the end is very sensitive. We would like to talk a lot, but okay. So as we close this session, let's not just see it as the end of the conversation, but it's the beginning of the collective journey toward the more resilience and the technology advanced healthcare system. Please give applause to all esteemed and excellency panelists, and thank you so much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Ibu Atik. And once again, ladies and gentlemen, technology has been always a big backbone in every part of our life. So we cannot ignore the technology. So if we want to improve healthcare services in Indonesia, we need to rely on technology. So thank you once again for our moderator on the third panel and also our panelists. And let's moving on to our last panel session, the fourth panel with the theme of Health Finance Discovery, Building the Sustainable Foundation of Indonesia Health Financing. And this panel promises to unravel the secrets of building a robust health financing foundation. Our moderator will be Bapak Pandu Harimurti from the World Bank, will guide us through this crucial discussion. Pak Pandu expertise spans Indonesia's health system, focusing on health financing, service delivery, health security, disaster risk management, and tobacco control. Thank you very much. Welcome on stage, Pak Pandu. Apa kabar? Good to see you, Pak. And Pak Pandu will be accompanied by our key representatives from Director General for Health Policy Agency, Ministry of Health, Republic of Indonesia, Ibu Sharifah Liza Munira. Thank you. Welcome on stage, Ibu Liza. And next we have the representative of USAID, Erin Nicholson, USAID Acting Mission Director. Thank you, Ms. Erin. And next we have the representative of Kabupaten Kota Sehat Sumedang, Ibu Tuti Ruswati, as beneficiary from UNICEF. Welcome, Ibu. Selamat datang. Have a seat. And last we have Ibu Rosita Dwi Yuliandri, Head of Disease Control and Prevention, Surabaya City Health Service, as beneficiary from USAID program. Thank you. Welcome, Ibu. And now I will let Pak Pandu to start our last panel discussion. The stage is yours, Pak Pandu. Thank you.
Thank you very much, Mas Vishnu. I think this session is strategically placed at the final, as a final session, because at the end of the day, it all comes to financing, right? So in Bahasa Indonesia, there's a saying, ujung-ujungnya duit, yeah? So let's get serious and start having discussion about health financing in Indonesia. I think Indonesia has made significant progress. It already doubled the share of public financing to GDP since 2015, and then already half the out-of-pocket expenditure after the implementation of social health insurance. But we would like to hear from Ibu Lisa on the current state and also what make it possible and also the challenges that health financing is facing as a part of the health transformation agenda. Yeah, the time is yours.
Thank you, Pak Pandu. I'd like to start with taking on a little bit of a general tone, where earlier in the first panel we saw one of the panelists mentioned that investing in health over time actually gives us more return on investment as opposed to depreciation. And I think the COVID pandemic really honed in on that. We can see that in the government budget, allocation for health falls under one of the fourth largest, along with education, social expenditure, as well as infrastructure. So, health is very top on the agenda of the government. I'd also like to highlight 3 key milestones that that Indonesia in the past 20 years has undergone. So the first one is decentralization, where the function of, provinces, districts were given a lot more authority, were given a lot more political power, as well as authority over health, over finance as well. And this has posed a number of challenges, I would say, because the local governments with the typical or previous pattern of centralized government were struggling to be able to produce public and private goods, making sure that the capacity of the local government is improved, as well as the other challenge is ensuring good financial management. So that was 20 years ago. 10 years ago, Indonesia also had a really strong milestone, kind of a game changer, I would say, in the introduction of the national health insurance. Now this, in Indonesia's health insurance, the BPJS, this really, it's one of the largest single payers for national health insurance. It's an effort to reach universal health coverage. It intends to cushion provide financial protection, and it also is meant to change incentive structures. So this has been going on for past 10 years. Very recently, the government has introduced something called the RIBK, so what was previously known as mandatory spending. With decentralization, the commitment for health financing from national as well as local government became important. But we saw that a lot of these fundings may have been either overlapping or gaps in an effort to make sure that the money follows the function, as opposed to looking at what money we have and then whether or not we can reach certain goals. In the new health bill that was issued, in the new health law, we have stated that we'll be having a health financing blueprint. And this will look into funding coming from public and non-public, and ensuring that it meets the national strategy goals that's coming up. And so I guess the challenge that you're mentioning, that you're asking, is whether or not we can be able to unravel a black box, I would say, between what, funding coming in. The minister mentioned the multiple sources of funding coming in to the health sector, and then the multiple uses. So the RIBK is hoped to uncover that black box. We're also looking into what incentives that can drive more funding coming from private sectors, from community, and making sure that these are driven in a more in the most efficient way. So I'll stop here and go back to you, Pandu.
Thank you. So these are the three important milestones and also the challenges that it posed. So that's very interesting to hear from the internal perspective. But I would like to turn to Ibu Erin to hear from the external perspective as a development partners in terms of health financing in Indonesia and also health sector transformation.
Great, thank you, Pak Pandu and Ibu Lisa, Ibu Titi, and Ibu Rosita. Nice to be a part of this panel. From a donor perspective, I'll speak big picture. To start with, USAID is a very proud partner working with Indonesia, and we've had a long-standing commitment to improving health outcomes in Indonesia. And recently, President Biden and President Jokowi met in Washington, and they agreed to the new U.S.-Indonesia Comprehensive Strategic Partnership. This is across a number of areas of joint collaboration, highlighting our cooperation, shared values of our two countries, and one of the areas is in the health sector. We're working to support health cooperation through increased research and technical collaboration, investment in human capital development, as we heard that's a big priority here in Indonesia, and strengthen the work on pandemic preparedness, prevention, and response, kind of learning from all of the experience we've had for the past few years. And as part of this, we'd like to strengthen our health partnership and working in collaboration in health financing and global health security. And more specifically to the question, I think as Ibu Lisa mentioned, the launching of the National Health Insurance Program in 2014 has really made remarkable progress in Indonesia over the past 10 years. Now we see almost 96% of Indonesians having access. And the JKN provides a comprehensive health benefits package which protects people from financial risks and advances universal health coverage. Further, in 2021, we've seen the Ministry of Health announce the 6-pillar health transformation initiative, including health financing transformation. That's why we're here today. And it's helping to improve accountability and transparency and to ensure that that big picture goal for universal health coverage. We welcome the opportunity at USAID to continue our coordination and collaboration with the Indonesian government and also with the partners and donors, and that's why we are so pleased to be a part of this today. We want to congratulate the Ministry of Health for bringing us all together to cultivate strong communications and relationship to advance health in Indonesia.
Thank you, Ibu Erin. So thank you to hear the commitment from USAID, especially in the area of health financing. Now we would like to turn to experience from subnational level. So we will use Bahasa Indonesia. So for those who still don't speak Bahasa Indonesia, can use the translation services. So I would like to turn to Ibu Tuti from Sumedang and to hear your experience in resource mobilization to help Kabupaten Sumedang addresses one of the main health issues in Sumedang, which is stunting. So, Ibu Tuti, the time is yours.
Terima kasih, Pak Pandu. Assalamualaikum warahmatullahi wabarakatuh. Alhamdulillah saya bisa berbagi pengalaman di sini. Kabupaten Sumedang pada tahun 2018 ini mengalami permasalahan yang sangat serius, di mana Kabupaten Sumedang mempunyai angka prevalensi stunting yang sangat tinggi, 32,2% pada waktu itu. Nah, sehingga Kabupaten Sumedang menjadi piloting 100 kabupaten kota se-Indonesia untuk penurunan stuntingnya. Nah, di sana untuk menanggulangi stunting, kita tidak mempunyai data. Kemudian efektivitas program itu tidak tepat sasaran dan sebagainya. Akhirnya kita tidak mau harus berpikir inovasi dan kolaborasi. Nah, prinsip Kabupaten Sumedang kita harus berkolaborasi dengan pentahelix ya, akademisi, bisnis, community, government dan media. Dan pada waktu itu kita membangun satu sistem informasi pencegahan stunting terintegrasi beserta Telkomsel. Dan Telkomsel kebetulan pada waktu itu juga mempunyai program kesehatan bayi dan khusus untuk stunting, akhirnya Kabupaten Sumedang mendapatkan dana dari CSR Telkomsel, karena Kabupaten Sumedang untuk menurunkan stunting seperti ini pasti terbatas sekali resources, baik itu dari sumber daya, sumber dana, sumber daya manusia dan sebagainya. Nah, bersama-sama dengan Telkomsel memberikan CSR sebesar 3 miliar pada waktu itu. Kita membangun simpati, dan dengan simpati ini ternyata Kabupaten Sumedang sangat terakselerasi, baik itu big data hari ini, detik ini dan jam ini pun bisa dilihat berapa balita stunting di Kabupaten Sumedang dan berapa balita di Kabupaten Sumedang seluruhnya gitu. Sehingga by name by address sudah bisa kita petakan, dan apa intervensi program untuk penanganan bayi stunting saat ini bisa dilihat. Nah, untuk literasi masyarakat kita pun mempunyai Wakepo, WhatsApp kebutuhan pelayanan online. Di sana masyarakat bisa berinteraksi untuk melihat khususnya untuk kesehatan, berapa sebetulnya siapa sasaran anak mana yang harus kita intervensi, sehingga semua stakeholder di Kabupaten Sumedang sekarang sudah fokus terhadap penanganan stunting. Dan simpati ini pun kita kembangkan dengan memberikan smartwatch kepada 1.000 ibu hamil, kemarin oleh Pak Mendagri sudah di launching, dan simpati ini juga sebetulnya cikal bakal juga diakomodasi atau direplikasi oleh Kementerian Kesehatan, jadi diapresiasi juga oleh Pak Menteri Kesehatan. Dan hari ini kita membagikan, kemarin seminggu yang lalu kita membagikan 1.000 smartwatch yang mengukur tentang beberapa monitor, di mana si Nurmi ini sistem screening kesehatan ibu hamil dan remaja putri, di mana alat ini mampu memonitor tekanan darah ibu hamil, kemudian kadar oksigen ibu hamil, kemudian lokasi pengguna, detak jantung dan jumlah langkah. Nah, sehingga dengan pembagian 1.000 ibu hamil ini, kita harapkan di Kabupaten Sumedang akan 0 angka kematian ibu dan 0 angka kematian bayi. Kemudian juga selain kolaborasi dengan Telkomsel, kita juga dengan Indosat dan Alita, ini juga membagikan smartwatch ini, juga kita membangun juga dengan India, ini sistem Dokuiti. Dokuiti ini satu bentuk artificial intelligence yang mendeteksi atau interaksi antara peserta pasien dengan dokter dengan 3 penyakit, yaitu tuberkulosis, hipertensi, dan stunting. Nah, ini masih dalam pengembangan. Kemudian juga untuk lingkungan bersih sehatnya kita pun membangun circular economy dengan PT Inti, kita kemarin ke Barcelona dan itu tindak lanjutnya, sehingga ada pendanaan untuk pengelolaan sampah di Jatinangor, Silicon Valley. Jadi Living Lab Silicon Valley-nya Sumedang gitu. Nah, itu saja mungkin yang bisa kami bagikan pengalamannya. Jadi pada intinya bahwa walaupun kita terbatas dana, walaupun kita terbatas sumber daya manusia dan sebagainya, kita masih punya stakeholders yang sangat aware terhadap kesehatan di Kabupaten Sumedang, dan harapan ke depan bahwa pendanaan ini tidak hanya terbatas dari government, tapi juga dari berbagai pihak. Itu Kabupaten Sumedang sudah membuktikannya. Tetapi ada juga harapan untuk keberlanjutan program. Kita menggerakkan 1.700 kader untuk memobilisasi data stunting, sehingga sampai saat ini Kabupaten Sumedang bisa mengintervensi bayi stunting di Kabupaten Sumedang. Maka perlu keberlanjutan program, perlu militansi. Kader ini sangat militan di daerah, sehingga mungkin perlu juga ada perhatian dari pemerintah terhadap insentif dan sebagainya. Untuk Kabupaten Sumedang kita sudah memperhatikan kader, tetapi sangat terbatas karena kader ini sangat banyak. Dan kemarin kita pun membagikan sampai 2.000 handphone dari Telkomsel. Kemudian untuk networkingnya kita pun dengan Telkomsel dan Icon Plus sudah memasang fiber optik di seluruh posyandu, di 1.700 posyandu, sehingga posyandu saat ini untuk input data itu tidak harus ke desa, tetapi bisa di posyandunya. Itu mungkin yang bisa kami sampaikan. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Terima kasih Ibu Tuti. Fascinating story. I think it deserves an applause. And I think next destination, Silicon Valley, Sumedang. That's an example on how local government using innovative approaches to address limited resources. Now we turn to Surabaya, and Surabaya has another story to tell about how Surabaya, as a site of one of the pilot implementation for strategic health purchasing for TB, and using that mechanism to incentivize private providers. Ibu Rosita?
Ya, terima kasih Pak Pandu. Selamat sore Bapak Ibu sekalian. Di sini Kota Surabaya juga akan membagikan pengalaman terkait inovasi pembiayaan untuk program TB, dan di mana untuk inovasi ini juga kita kerjasama dengan Kementerian Kesehatan dan juga BPJS Kesehatan, di mana hal ini juga menjadi jawaban dari upaya-upaya yang sudah dilakukan pada program private mix, karena program private mix itu kemarin kita juga mengimplementasikan untuk mendapatkan SKP atau satuan kredit profesi untuk physician atau dokter praktek mandiri, akan tetapi itu ternyata tidak terlalu memberikan impact yang signifikan. Jadi ada beberapa yang memang kita keluarkan setiap 6 bulan, kolaborasi dengan ID, tetapi tidak cukup menarik. Akan tetapi dengan adanya mekanisme pembiayaan ini, ternyata ini memberikan stimulus yang berbeda untuk di layanan swasta dan layanan primer. Di sini inovasi pembiayaan program tuberkulosis bersama Pusjak, Kementerian Kesehatan, sasarannya di non-kapitasi dengan memberikan insentif ke FKTP atau fasilitas kesehatan tingkat pertama dengan melibatkan puskesmas, kemudian klinik, dokter praktek mandiri dan juga laboratorium swasta, di mana untuk peserta syaratnya adalah peserta aktif JKN yang usianya lebih sama dengan 5 tahun. Dan ini sudah diimplementasikan di 6 lokasi, yaitu Medan, Jakarta Utara, Bogor, Semarang, Denpasar, dan Kota Surabaya. Dari hasil monitoring dan evaluasi terakhir menunjukkan bahwa Kota Surabaya merupakan satu dari 6 kota yang dengan cakupan klaim terbanyak, dan dengan mekanisme verifikasi dan validasi finance yang lebih clear. Nah, di sini kami ingin berbagi bahwasanya dalam kegiatan ini juga sumber pendanaannya non-kapitas dari DFAT, jadi dari perdagangan Aussie, Australia, kemudian operasional dan monefnya difasilitasi oleh USAID, GF, WB dan Gates. Kemudian di sini kami memang mengalami tantangan karena waktu implementasi di Kota Surabaya kami berbenturan dengan regulasi. Karena waktu itu di Pusjak dari Kementerian untuk Kemenkesnya belum keluar, akhirnya jadwal yang harus diimplementasikan segera di bulan Juli sampai dengan Oktober, itu akhirnya mundur, Oktober baru keluar regulasinya. Hal ini yang menjadi hambatan bagi kami di Surabaya karena mekanisme untuk finance dan terkait keuangan itu juga kita mempunyai kebijakan sendiri. Oleh sebab itu implementasi baru bisa kita laksanakan di bulan Oktober kemarin. Ternyata dengan telatnya implementasi, cakupannya tidak telat, alhamdulillah, jadi progresnya luar biasa, sehingga ada beberapa mekanisme koordinasi yang telah kami lakukan. Yang pertama, kerjasama dengan lintas bidang terkait, Karena di sini untuk puskesmas yang ada di Kota Surabaya sebanyak 63 puskesmas sudah berstatus BLUD, Badan Layanan Umum Daerah, yang tentunya secara regulasi itu ada mekanisme khususnya, sehingga kita melakukan penganggaran menyesuaikan dengan kebijakan dari BLUD. Kemudian kita juga membentuk tim task force untuk memberikan update kebijakan dan pendampingan supaya bisa memberikan pendampingan intensif kepada Fasiankes. Kemudian kita juga kolaborasi dengan tim GF dan USAID untuk melakukan intervensi dan juga melakukan mapping Fasiankes, kemudian melakukan perhitungan target serta bimbingan teknis ke Fasiankes. Di samping itu kita juga membuat SOP untuk layanan dan mekanisme pembiayaannya. Jadi awal kita upaya yang dilakukan adalah sosialisasi kepada seluruh Fasiankes terkait uji coba tersebut. Kemudian kita juga menindaklanjuti dengan surat kepala dinas dengan menunjuk tim teknis dan target pelaksanaan uji coba tersebut. Dan kita juga menghitung target di masing-masing wilayah puskesmas. Dari target tersebut kita evaluasi secara berkala setiap minggu, kemudian kita juga menghitung proporsi dari jumlah kepesertaan BPJS di masing-masing Fasiankes. Dan kita dilanjutkan dengan OJT untuk aplikasi klaim dan kelengkapan klaim, kemudian juga pertemuan koordinasi yang juga melibatkan pemerintah pusat untuk mengevaluasi kinerja dari Fasiankes. Kemudian yang tidak kalah menarik karena memang sosialisasi ini terkait laporan finance yang tentunya harus inline dengan BLUD, kita juga mengintegrasikan dengan aplikasi yang sudah ada di Kota Surabaya, yaitu aplikasi keuangan e-delivery, dan itu nanti semua pelaku atau Fasiankes baik klinik maupun laboratorium itu harus mempunyai akun LPSE atau layanan sistem elektronik untuk pengadaan. Dan ini nanti harus inline dengan aplikasi yang sudah ada di Kota Surabaya. Dari hal tersebut kita bisa mengevaluasi secara akuntabel dan transparan bentuk inovasi yang ditawarkan oleh kementerian. Tidak hanya menerapkan secara letterlock, akan tetapi kita modif sesuaikan dengan kebijakan yang ada di pemerintah kota. Dan itu pun efektif dan menurunkan resiko missing untuk perhitungan dan perhitungan keuangan dan alokasi anggarannya, termasuk perhitungan pajak. Karena kita mengacu pada Kemenkes nomor 14 tahun 2015 untuk PPH atau pajak penghasilan 23 yang nantinya juga harus include di klaim untuk ronsen 120.000 yang sudah masuk melalui mekanisme pembiayaan inovasi tersebut. Jadi untuk tantangannya kita terkait regulasi kemarin memang baseline dari kami untuk implementing itu adalah terkait regulasi, kemudian kelengkapan dokumen yang harus diverifikasi secara detail karena harus ada MOU. MOU-nya itu pun juga kita revisi memasukkan pajak di situ, kemudian ada MOU untuk X-ray, kemudian penunjukan rekening bagi masing-masing Fasiankes. Karena mekanismenya nanti insentif ini sebagai jasa pelayanan bagi puskesmas dan insentif bagi layanan swastanya. Kemudian di aplikasi klaim kemarin juga kita ada kendala, akan tetapi sudah bisa kita atasi. Kemudian kepesertaan BPJS, nah ini yang kemarin menjadi hambatan khusus karena ternyata ketika kepesertaan BPJS di Fasiankes tersebut tertera di Fasiankes tetapi ternyata tidak berdomisili di situ, itu pun juga tidak eligible, sehingga seharusnya aktif saja kepesertaannya sehingga lebih leluasa untuk mengurangi miss opportunity dari sasaran yang memang harus masuk di pembiayaan ini. Kemudian harapannya dari rekomendasi yang sudah kami susun di sini, ini nanti ada penambahan klausul dalam kebijakan yang dikeluarkan oleh kementerian, sehingga nanti untuk kebijakan di klausul ini menyebutkan bahwa ada kebijakan keuangan terkait mekanisme keuangan yang menyesuaikan aturan dan ketentuan yang ada di masing-masing kabupaten kota. Kemudian yang kedua, untuk kriteria yang eligible cukup memiliki BPJS Kesehatan saja yang aktif, tidak perlu melihat kepesertaan BPJS di Fasiankes mana. Karena itu menjadi hambatan kami sehingga pelaksanaan beberapa kepesertaan atau sasaran itu tidak bisa kita klaimkan dan tidak bisa kita fasilitasi melalui mekanisme inovasi pembiayaan ini. Mungkin itu yang bisa kami sampaikan di sesi ini. Kami juga berharap ke depan pembiayaan ini bisa di-extend, kemudian bisa diekspansi ke seluruh layanan atau kabupaten kota yang lain, dan tentunya harapan kami dukungan dari pihak donor ini tidak hanya nanti untuk meningkatkan notifikasi kasus, akan tetapi kami juga berharap nanti ada mekanisme seperti halnya di COVID untuk bisa percepatan penemuan vaksin TB. Mungkin itu, matur nuwun. Assalamualaikum.
Thank you very much. Thank you, Bu Rosita. So I guess the last round will be on looking forward. So we've heard about innovative approaches in health financing and the need to use systematic approach in the field. But I would like to hear from Bu Erin quickly on what would be the innovative approaches and in the future. Yes, and then Ibu Lisa.
I'll keep this brief because I know we're short on time. But we at USAID, we do have a policy on private sector engagement. And so I think this example that we're piloting here in Indonesia is a chance for us to experiment and learn more of how we can mobilize more resources to provide public services with partnerships with the private sector. So I think you'll see more of this and learning from this experience. So I'm really pleased that we could have firsthand experience on how it's working on the ground. And I think continuing to work in partnership with the Ministry of Health, the vision for the ministry is so strong. And we are thankfully resourced from our own taxpayers in America to help continue our partnership, and we look forward to continuing that. Thank you.
And now, Ibu Lisa, so what would be the next steps and in the future new innovative further innovative approaches for health financing?
Thank you, Pak Pandu. We've heard, the examples that are already in place, a number of issues that need to be addressed, and I think that's the use of, that's the beauty of having a pilot. One of the challenges, obviously, is moving the bureaucracy, alongside these innovative financing models. But it's very important to see which bottlenecks need to be addressed and how we can use, innovative financing mechanisms to address that. One of the things that we're trying very hard to do is collect enough information or data. So the priority programs in our health financing pillar has been one, for instance, the health accounts. This is intended to really look at the flow of funds coming at the national level, the provincial level, the district level. This would help us understand, what sources are coming in, knowing that, for instance, in 2022, 55.4% of funding for health is from public sources. This also tells us that, the spending rate will likely continue to grow well above the GDP growth, and knowing that the growing burden of non-communicable diseases is going to pose a lot of challenges and pressures on our budget. So innovative financing is obviously very important. We have priority programs in health technology assessments, which would really help us allocate funding. And then we have our JKN system, where tariffs are being reviewed and analyzed and to be closer to the market rate, if anything. And then the consolidation of the national and state budgets, and then having a review. So these priority programs, moving forward, we would really anticipate and need support from partners in the room and, that is supporting Indonesia to help us finalize and improve the reforms that we're doing on each of these different priorities. We're building up a new INA groupers for the JKN, which would then lead to tariffs that are more efficient, the HTA business process, the health account that really reflects money coming in, and then how do we make sure that the utilization reviews from tariffs can then flow in to, regulations and standards that need to be in place. So moving forward, we look forward to working with, partners in the room to help us make that, health financing and the health sector more and more efficient.
So I think that's one of the key words in health financing that is important, which is increasing efficiency in health financing. At the time when there's an increasing spending, but at the same time, we need to make sure that there's an efficiency of the money that the government has. So again, thank you very much, the distinguished panelists, for this inspiring discussion. So with that, I would like to end this session, and again, I would like to thank you, the panelists, and also the audience. Thank you.
Thank you, Pak Pandu, and all panelists. Thank you so much for the wonderful last panel session. Thank you. You may return to your seat, Pak Pandu, our moderator, and all panelists. But for Ibu Sharifah Liza Murira, please remain on stage, Ibu, to deliver the closing remarks from the Director General for Health Policy Agency, Ministry of Health, Republic of Indonesia, who will share key takeaways from today's meeting and set the agenda for our collaboration in the 2024. Please, Ibu Liza.
Thank you. What a day we've had today. The celebration of our collaboration in the health sector between the Ministry of Health and all of you, development partners, implementing partners, public and private sectors, experts, and many more. I remember 20 years ago in Bali, in Nusa Dua actually, health was tabled for the first time in a forum called Consultative Group for Development. This was mainly led by donors and development partners together with the government. But today we inaugurate our first health partners meeting and with all of you, and we thank you very much for your continued support and many more support to come. I think we all enjoyed the in-depth conversations we had both in the room and perhaps also as well outside, and I trust our conversation will continue beyond this very theater room, maybe on the flights back or over coffee back in Jakarta. We've heard and seen best practices of our collaboration, and we hope to move forward together to advance the health transformation pillars and programs, as well as have concrete actions. Our 6 pillars, which would have heard over and over again from the Ministry of Health, and hope that this is already instilled in all of us. Our vision for our first pillar is to emphasize the prevention strategies, which need a very strong and constant commitment from all stakeholders. For our second pillar, it's upgrading and strengthening our hospital capacity, which is also crucial in achieving the critical indicators of the referral system in priority diseases such as what we call KJSU, or kanker, jantung, stroke, uronephrology, so cancer, stroke, cancer cardiology, stroke, and urology. And our focus in the health system's resilience transformation will be on strengthening the surveillance system, new vaccine introduction, the new technology on medical devices and medicine. On the other hand, Indonesia is very urgent in need for more health talents, especially doctors with increased qualities. Now, above all, what we ended today in our last panel was establishing a sustainable health model in financing as a major foundation in all of our health transformation programs. For a more accountable and predictable international partnership process, I'd like to invite you to give suggestions actively so we can build the process better for any one of us, for each and every one of us. I'd like us to all identify bottlenecks together and communicate intensively to find best solutions. My team is committed to help and support you on this. Ladies and gentlemen, as the Minister explained, this event will certainly not be a one-off event. We plan to have other ones twice a year, and the most critical point, obviously, is having those follow-up steps. And just like a menu in a restaurant, I do hope we've given you a complete menu to enhance our partnership and collaboration. So let's synergize our collective commitment to ensure healthy lives and promote well-being for all at all ages. I'd like to close by expressing season's greeting, a happy Christmas for those who celebrate, and happy holidays and a happy new year in 2024. Let's bring this positive energy in 2024. Thank you.
Thank you very much, Ibu Sharifaliza Munira, the Director General for Health Policy Agency, Ministry of Health, the Republic of Indonesia, for the closing remarks and the takeaways from our discussion on today's event, that we hope together this meeting can strengthen our partnership and also our collaboration in making health services in Indonesia even better. Right before we close, we end this session, let's hear once again our performer, the 6 soloists who come join together in a group of a cappella called Sixth Harmony.
Hello, we are back.
Good afternoon, ladies and gentlemen.
And this one is coming from Gloria Gaynor, You're Just Too Good to Be True.
We hope you all can sing along and enjoy with this performance.
You're just too good to be true. Can't take my eyes off of you. You feel like heaven to touch. I want to hold you so much. At long last, love has arrived, and I thank God I'm alive. You're just too good to be true. Can't take my eyes off you. Pardon the way that I stare. There's nothing else to compare. The sight of you leaves me weak. Oh, there are no words left to speak. But if you feel like I feel, please let me know that it's real. You're just too good to be true. Can't take my eyes off of you.
Everybody can clap your hand, come on.
I love you, baby, and if it's quite alright, I need you, baby, to warm a lonely night. I love you, baby. Trust in me when I say, oh, pretty baby, don't let me down, I pray. Oh, pretty baby, now that I found you, stay and let me love you, baby. Let me love you.
You're just too good to be true. Can't take my eyes off of you. You feel like heaven to touch. I wanna hold you so much. At long last, love has arrived, and I thank God I'm alive. 'Cause you're just too good to be true. Can't take my eyes off of you. Everybody, come on!
To warm and lonely nights. I love you, baby. Trust in me when I say, oh, pretty baby, don't let me down, I pray. Oh, pretty baby, now that I found you, stay and let me love you, baby. Let me love you. I love you, baby. And if it's quite alright, I need you, baby, to warm my lonely nights. I love you, baby. Trust in me when I say,
ooh, yeah. Thank you. All right, we're
you
gonna
so
still do one
much.
more song. I hope we had a great time.
Yes.
If we want to stand on our feet also, and maybe move our body a little bit, if we want.
We are sure everybody know this song, so we can sing along and dance. Or just waving your hand or just clap your hand. Come on.
Ooh, yeah. Come on.
Clock strikes upon the hour and the sun begins to fade. Sailing outside to figure out how to chase my blues away. I've done it wrong up to now, and days and all that shows me how. And when the night falls, my loneliness calls. Sing. Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me. Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me.
Sing. Oh, I've been in love and lost my senses, spinning through the town. Sooner or later, the fever ends, and I want to feel it down. I need a man who'll take a chance on a love that burns hot enough to last. When the night falls, my lonely heart calls. Sing.
Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me. Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me.
Don't you want it? Somebody who loves me. Oh, somebody to hold me in his arms. I need a man who'll take a chance on a love that burns hot enough to last. When the night falls, my lonely heart calls.
Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me. Oh, I wanna dance with somebody. I wanna feel the heat with somebody. Yeah, I wanna dance with somebody. With somebody who loves me.
Can we all help us together? Clap our hands. Come on. Hey. Guys, are you ready? Don't you wanna
Dance.
with baby?
Don't you wanna dance?
Dance.
With the boy?
Don't you wanna dance?
With the baby? With somebody who loves me. Don't you wanna dance, say you wanna dance, don't you wanna dance, dance. Don't you wanna dance, say you wanna dance, don't you wanna dance, dance. Don't you wanna dance, say you wanna dance, don't you wanna dance, baby. With somebody who loves me. Ooh, yeah. With somebody who loves me. Thank you so much. Have a good
Thank
time.
you. Sixth Harmony. Once again, please give a round of applause for our last performer. Thank you, and it's a wrap for today's agenda, ladies and gentlemen. Thank you very much for joining and coming to Indonesia Health Partners meeting in Bali. But don't forget to join our networking dinner that will be started at 6:30 p.m. Bali local time in this building on the second floor at Nusantara Room. So on behalf of the committee, I'm Wahyu Wiwoho signing off. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh, and enjoy Bali. Bye-bye.